Frankfurt Independence moving for August 3rd, not August 26th.
We are going to go ahead now and call this board meeting to order at, what time is it, 6:44 p.m. And we would like to welcome everyone here. And at this time, we would like to have everyone stand for a moment of silence and we'll call our pledge. Now the pledge.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
No, it's mine. I was in your seat whenever I came in, I got confused. They said that's why, they said you came in late because I had all my stuff. Okay, item number 1, review of the agenda, which is involved by number 2, adoption of the agenda.
If I could ask number 13, consider approval of the GRC High School Boys Soccer Team to attend the FC Cincinnati Professional Soccer Game. Please take that off at this point. That will be considered at a later date if it's a feasible thing to do. Mr. Thomas, do we need to add anything to the agenda for that item they just passed? So that would read differently.
Under number 11, we'll be able to operate it under 11.
Okay, under that.
Anything else? Anybody else want to add or change anything else?
So just to clarify, Mr. Thomas, you say that we could just simply, within number 11, just specify who the bonding agent is?
That's correct, and I've already looked at the municipal advisory agreement as well.
Thanks.
Adoption of the agenda. Make motion for adoption of the agenda.
Make a motion to adopt the agenda.
Motion by Mr. Colby,
I'll second.
second by Ms. Richardson. All those in favor say aye. Opposed? Motion carries 5-0. Item number 3, approval of minutes for June 15th, 2020 regular meeting, June 29th, 2020 special meeting, and July 13th, 2020 special meeting. Anybody have any discussion, questions, concerns, or motion?
Move to approve as written.
Motion by Mr. Carroll.
Second?
Second by Mr. Heisel. All those in favor say aye. Opposed? Motion carries 5-0. Second by Heisel. All right, we have some people that have signed in to speak. So we are going to start with Mr. Foudray.
It's a very tense time. Lots of people are scared. Just start off my comments by acknowledging that and acknowledging that no one that's here to speak tonight thinks that anyone has doesn't have our best interests at heart. Okay. I wanted to speak to you tonight to formally and publicly provide you with the concerns of teachers who have reached out to me on the record and provide you with the Clark County Education Association's input regarding the district's reopening plans. I'll begin with 4 points that we as a representative body for the teachers want to make. Point 1, risk. According to CDC, the more people a student or staff member interacts with, and the longer that interaction, the higher the risk of COVID-19 spread. The risk of COVID-19 spread increases in school settings as follows. This is from their website. There's a lowest risk category, a more risk category, and the highest risk Highest risk is for full-size in-person classes, activities, and events. Students are not spaced apart, share classroom materials or supplies, and mix between classes and activities. Point 2, Kentucky's COVID-19 numbers. Kentucky had 979 new COVID-19 cases in one day yesterday. I haven't seen the news for today. Largest single number day numbers on record. 30 of the new cases were in children under 5 years old, and the governor's comment was, "This ought to be a wake-up call for everybody." I also checked out Kentucky's 7-day average of new COVID-19 cases. It's higher than ever. Dr. Peter Hasselbacher, a Louisville physician, and he runs a website that tracks, he's with the University of Louisville School of Medicine. He runs a website that tracks the 7-day rolling average for Kentucky. He reports a steady increase in the average of positive tests since the May 25th Memorial Day holiday, when people began to get out and do more. Restrictions on businesses were eased. He says, quote, "The 7 highest daily reports of the epidemic have come since July 1st. We are in a new territory." According to a report from WKYT last week, COVID is back at the threshold percentage of cases that would constitute closing down some public activities. And CDC models from various sources predict the infection rate in Kentucky will continue to rise throughout the next several weeks. Point 3, actions of other districts. With board and superintendent support, Jefferson County Schools announced it cannot safely open to in-person classes. According to Superintendent Polio, quote, "In the end, the weight of possibly having an employee or even a student die as a result of a decision, it makes it very difficult to not err on the side of safety. The majority of Fayette County school boards say schools cannot safely open to in-person classes." Quote, this is from Stephanie Spires, the chairwoman of the board. "Until we see decreased cases and increased rapid testing, I do not believe we can safely reopen our schools. For me personally, I'm not going to send our kids and our staff back into the classroom until we have those things. For those who say Fayette and Jefferson are big cities who are at more risk, Bourbon County Schools announced it cannot safely open to in-person classes. According to Bourbon County High School's announcement regarding the move to their online work, quote, the school board, could not guarantee the safety of students, staff, and their families. I assume these developments put our district in some legal peril, more so than the districts I just mentioned. If a staff member, student, or their family member were to become very sick or die from the virus as a result of being in school." Point 4, guidelines and sick leave. The OSHA Act requires all workplaces to be, quote, "free from recognized hazards that are causing or likely to cause death or serious harm to employees." The Centers for Disease Control and Prevention has determined COVID-19 is such a hazard. Accordingly, OSHA recommends that during this crisis, employers should consider, among other things, the use of, quote, "remote communication strategies." The Americans with Disabilities and Amendments Act would allow faculty members who have a physical or mental impairment that, quote, "substantially limits a major life activity," are able to perform the essential functions of their job at home if they have requested and received approval to work from home as a reasonable accommodation for their disability. Even a person with only a record of disability, such as the history of cancer, or no disability at all, but whom others regard as disabled, is protected. The Equal Employment Opportunity Commission has suggested that if employees have conditions that make them more susceptible to COVID-19, employers should take steps to eliminate the direct threat posed by COVID-19. Despite these guidelines, the federal government's COVID-19 sick plan, FFCRA, which we talked about last week, does not fully cover employees such as Clark County School staff. There are multiple instances of holes in this plan through which staff can fall through. For one example, a staff member or their family member faces the very real possibility of getting the virus at school, being hospitalized for an extended period of time, being forced to take multiple days, perhaps multiple weeks of unpaid sick leave. Here are the conclusions. First, Clark County's 5-day per week in-person plan for school is officially high risk. 2, Kentucky's new COVID-19 infection numbers are higher than they were when we shut down schools last spring, and all indications are they're going to continue to get higher. 3 other districts have indicated they cannot safely open schools with the type of plan that we are planning for. 4, despite federal and advocacy agency guidelines about the risk of COVID-19, available sick leave policy for Clark County school staff does not adequately protect us from COVID-19. particularly the 5-day per week in-class model. These are our recommendations, or what we are asking. It's for these reasons that the board of the Clark County Education Association asks that you do not vote to open schools to 5-day in-person classes. However, if you do vote to allow the 5-day per week in-person model, we ask that you take the following steps to mitigate the high risk to staff, students, and families that come along with this plan. First, you could notify staff in writing or email prior to the start of school, letting them know they have the option to work from home throughout the pandemic if they or a family member in their home is immune compromised, specifically with regard to COVID-19, with no repercussions. District creates a policy, or you could create a policy on a threshold of infections at the state, county, school district, or individual school level that would necessitate shutting down a school or the district for a minimum of 2 weeks. You could create a policy on mandatory masks and social distancing throughout the district, as well as definitive consequences, not punishment, but consequences. The district could create a policy guaranteeing no teachers have to use their own sick days or take an unpaid day of leave as a result of COVID-19. You could create a policy on students and faculty quarantine procedures throughout the district. If a student or staff member gets the virus, presents with symptoms, or is exposed to the virus at school or elsewhere, it must be quarantined per health guidelines. They must take a COVID-19 test free of charge and receive a negative on the test before they can return to school. You could create a policy on cleaning and cleaning supplies. Cleaning processes at each school must meet the CDC standards, and the district must provide the necessary cleaning supplies. That was cited by Bourbon County as one of the reasons why they could not open. And finally, the district ensures enough positions to cover new COVID-19 related procedures, such as screening, cleaning, supervision. I'll end, and then there are a couple more people who are going to speak after me. I gave my personal cell phone number to every teacher in the district via email, and I just asked them, what are your comments? What are your concerns? I did this about a month ago. I'd also asked Mr. Christie to be placed on one of the committees that the district had for reopening. I want to share some of those results. My call for questions from staff. We've had 84 people so far. Last week when I spoke with you, I had 75. So I've had 84 people so far have responded. Those are all different people, not the same person making multiple responses. I promised to preserve their anonymity, and I'm going to do that, continue to preserve their anonymity. Many stated they do not feel comfortable sharing their true feelings with an administrator or central office. I asked for staff feedback because I'm the district association president. I'm on that committee, as I said, and I wanted staff input to guide my participation. I wanted to hear honest opinions, not shade questions to get results that I wanted. I felt it was important that I share this information, particularly since the district asked staff members 2 questions in their survey. I'm paraphrasing, but I believe it was, do you or someone you live with have medical conditions that could be risk for COVID-19? And do you intend to return to work? And those results were presented last week. According to comments sent to me, a clear majority, 75%, either support online learning, students attending 2 days per week of in-person instruction and 3 days of online, or they have serious concerns about the 5-day in-person model that the district is planning for. But those last people did not state a clear preference for one of the 2 other alternatives. In total, 19% support online learning is the best option. 18% supports the hybrid plan of 2 days in class, 3 days outside of class, and the kids would rotate. So half the kids in the county would be there for 2 days a week, Monday and Tuesday, and then the other half Thursday and Friday. 38% had concerns about the 5-day schedule, but they did not indicate which of the alternatives they prefer. 12% supported 5-day in-person classes, and 13% were undecided and had no clear preference. At this time, I'll stop. Thank you guys for listening to our requests and our recommendations and the results of my attempt to get people to be involved in the process. I know it's difficult, and I don't intend to point fingers or anything like that at anyone here. Right? And say that someone, like I said, doesn't have our best interests at heart. I just want to make those feelings known and do it publicly and on the record. So I'm going to send my comments to you guys on email, the updated comments, so they can be a part of the official record. Thanks.
I'll be reading some of the concerns from staff that Mr. Fuder collected. When it comes to COVID-19, I have only 2 words. I'm scared. I'm scared because every day it seems like we are finding out more things about this deadly virus. How it spreads, who's at risk, who gets it, what safe protocols are, if you can get it multiple times, contradicting information, and unknown information. I'm scared because there's no vaccine. I'm scared because you can have it, spread it, and be asymptomatic. I'm scared because now I can stay at home and avoid social situations, stores, close contact with people I have controlled. My child and I choose to follow the guidelines to keep us healthy and safe. We wear masks, we attend church, we have online, we have telehealth appointments. I did not, however, have control over the households of 100+ students, which I would be exposed to. I'm scared because our schools are so big. From the bus to the classroom to home, students and staff are literally in contact with hundreds of students a day. And if those students are only in contact with one person at home, that puts our exposure, my exposure, at 300 contacts at a minimum. One asymptomatic student or staff could expose, have contact with 20% of the school in just one day. I'm scared because taking temperatures in the morning as students come into school cannot necessarily identify all of the high-risk / possibly infected students. I'm scared because the number of cases in Kentucky are rising at alarming numbers and we are planning to come together, not stay apart. I'm scared because I've heard nothing about testing students and or staff for the virus once, let alone regularly. I'm scared because I've not heard of a detailed policy for requiring students to wear masks. Students who refuse, students who can't, students who don't wear them properly. I'm scared for my peers that work with preschool, kindergarten, and special needs students that are required, who are not required to wear masks. I'm scared for the families of students, high risk and low risk, who are going to be exposed through school contact on a regular day. I'm scared for my coworkers, many of whom care for elderly parents who are high risk, have spouses and or children at home that are high risk, and are at high risk themselves. I'm scared for my family because of the exposure that I will every day experience when I go to work. I'm scared because contradicting this virus would be devastating to me. I'm a single parent. How would I take care of my child when I contract this virus because doing my job puts me in a high-risk situation? I'm scared because contracting this virus and being quarantined could take all of my sick days, emergency days. I have no savings. Deducted days would mean that I would have to choose which bill I don't pay. At the end of my career, I will also not have those sick days to help with my retirement. I'm scared because I need my job. I'm scared because doing the job that I love is now putting my child, my peers, our students, and me in danger. It seems reasonable to expect that no one should return to school until the federal and state government offers clear, specific policies and resources to guarantee the health and safety of students and staff. Asking us to go back into a classroom where we have the potential to spread COVID-19, a potentially deadly disease currently causing a global pandemic, to our students or their loved ones is asking too much of us. I can't even begin to imagine the pain that would be caused to me if I was personally responsible for the death of one of my students or colleagues. Our number one priority is to keep kids safe, even above educating them. That's just basic, standard, non-negotiable. And if that's our number one priority, then we have to do that. Infections can result in death. What do we tell students if their classmates die, their teachers die, or someone's family member dies directly as a result of reopening our schools? With rising infections in the state and our community, the odds are that this will happen. We used to think that children couldn't get COVID-19, or if they got it, they didn't spread it. However, a recently published study revealed that 65,000 students in South Korea showed that children younger than 10 transmit COVID-19 at a much lower rate than adults, but the risk is not zero. Children between the ages of 10 and 19 spread the virus as well as adults do. This suggests that if we reopen our schools as scheduled, we will have outbreaks like we're seeing in Fountain Circle, but potentially at a much larger scale. I believe that for at least the first 9 weeks, we should decide to do virtual learning, then reevaluate based on whether or not we have flattened the curve where a vaccine has been developed. We should decide this soon because teachers need time to process, practice, and implement new initiatives needed for virtual learning. Many of us have been spending the summer learning as much as we can about virtual learning. That's not saying this won't be a perfect execution without bumps. It will be new for everyone. But when our students encounter new challenges, we don't tell them to throw in the towel or not move forward just because it is unfamiliar or difficult. We provide them with all the necessary resources, and then we encourage them to persist, be creative, and learn. Therefore, having teachers develop the ability to educate our students effectively and meaningfully in a virtual setting can only be a positive in a world that is ever increasingly expanding online. Lastly, making the argument that virtual learning didn't work very well in the spring, therefore it's not a viable option now, is deeply flawed. It didn't work well, perhaps, because we had no time to prepare. We had very limited resources, and it was born out of a completely unexpected national shutdown. It wasn't virtual education, it was emergency learning. If we are given the resources and time, it will be much more impactful and effective moving forward. Give us the opportunity to prove that and to keep our students and ourselves safe. I'm scared to death of it. I just don't think teacher safety has been a priority, especially for high-risk teachers. Are we really prepared for teachers to die if school reopens to full in-person classes? Thank you.
I think they get your, yeah,
I don't have a writing utensil.
Brent Sizemore.
Ladies and gentlemen, I'll continue reading from the list that Ms. Lynch.
Wait a minute, I'm gonna have to call on Mr. Thomas.
If you want to give a public comment about what you believe, that's the whole purpose of the public comment. And I understand and I fully appreciate Mr. Foodgray's the anonymity for the teachers. If those want to be presented to the board in a written form so they can have that, that's fine. But the purpose of public comment is for you to tell the board what you believe, so that but it's not a mechanism by which you can take what anonymous readings and read them. But I mean, I think that the board clearly is interested in what your positions are. Those just need to be forwarded to those, and maybe Mr. Foodgray can send those to the board members. But I don't think this is the forum, the public comment section, to do that. Okay.
So if you want to give your opinion, I mean, we want to hear that.
No, I don't have any prepared opinions on myself.
Sorry, I didn't mean to throw it on you
No,
when you
no.
came up here. I was just,
No, thank you.
sorry. I cannot, is it Kate?
Yes,
Okay.
right. I was here with Mr. Cooper as well. My comments are mixed in with everyone else's in this list.
Okay. Did you want to speak on anything?
Not separately, one's already on the list.
Okay. Whitney Peck?
I'm here with them too, but I do have a few comments.
Okay, come on up.
Whitney Peck, I'm the F&B teacher at Justice Elementary. My main concern is we haven't heard anything about our population coming back into school. A lot of our students are not going to be able to follow the guidelines. They're not going to be able to wear masks, wash their hands. We're still working on basic hygiene skills. Most of our kids, we still take them to the bathroom. They have to receive assistance with all bathroom routines. Also, while feeding, we still have to feed our students. So there's no way we're ever going to be able to be 6 feet apart. Most of our kids are still working on basics like let's not pick our nose, let's use a tissue. Working on play role, play with your peers during class time. A lot of those daily living skills that we work on every day, we won't be able to work on those as well. So I guess my main concern is we're not hearing anything about our population. There's not a plan for that, as well as a lot of my students, I don't see how they're going to be able to return at all since they're not able to follow the same guidelines as everyone else. And then two, what happens with the ones that are in the classrooms with the special ed population? It seems like all the other teachers are covered under these guidelines, but with us and our students, it just seems like we're kind of left out. And we all love our students, me and some other staff, just us talking, we love our students and we love our jobs, but at the same time, for instance, I just had a baby, so I'm really concerned about my newborn. I don't know if he's going to be able to fight it off if I bring this home to him. But I just hope that you, when you guys are making these decisions and stuff, you also think about the special ed population, what that's gonna entail for them, what it's gonna look like and stuff. So, thank you.
Thank you.
Just for the record, the special education and preschool guidelines just came out from the governor's office today.
I'll mention that on the other day.
Shauna Mitchell.
Thank you all for letting me speak tonight. I come as an advocate for my colleagues at Shear and for parents and students alike. And this comment is mine. I was asked 2 things on a survey. Was I planning on returning? Yes. Do I have health issues of my own or in my house? I do not. Then I was asked through a text of a colleague who was on a planning committee if I was comfortable taking children's temperatures at the midpoint of the day. And I answered yes. I can take temperatures, mask to mask, quickly. But what I was not asked, and what I am afraid of, is the responsibility of behavioral, academic, social, and emotional well-being of a traumatized group of humans stuck in one room in my elementary classroom, as well as other grades, 5 days a week, 7 hours a day, in an environment where we cannot use proximity as a comfort. And I don't know how to do that. No one has asked me that last question, and my answer then becomes a very clear, scary no. As a family, we are choosing to keep my 2 kids at home, not because of a fear of a disease, although that is a very real fear. My husband and I have chosen to keep our kids home this year, a student at Baker and a student at the high school, so that we can thin out another teacher's classroom, so that we can make way for children who don't have that option. We as adults have that power to choose for them and with them, to make technology across the district a priority as fast as we can, and to go virtual for at least the first 9 weeks, if not the first semester, like other districts around us. I appreciate your time and thank you very much.
Let me see the comments. All right. Item number 4, consider approval to adjust the 2020-2021 final allocation to school councils. Ms. Ellis, office. Is she here?
We are asking, in the current staffing allocation, the 4 elementary schools have a half-time custodians. They're 181 4 hours a day. And due to the whole COVID-19 situation and cleaning and trying to keep the building clean, we were asking that the board would basically add 4 hours to those people. So that's 4 people in the district, and that would add 4 hours. And the estimated budget is about $46,000 the salary and benefit to make them a 181 8 hours a day, so that we have that extra time of that person in the building helping clean. And that's due to the specific COVID-19 situation. And with that being said, when we did get clarification, Donald and I, when we spoke with FEMA on 7/15, that if it is in a board meeting and it has specifically been allocated a position to increase time of a current salary person or even add a temporary person during this year of COVID-19, that if it's written in the board minutes that way and specifically approved that way, that's not a budget item that we initially had, that is something that we can turn in that cost to FEMA for reimbursement, because it's been caused by the COVID-19 situation.
What if we don't go back to school? Then what happens?
That is,
I think probably when we would advertise, if you were to approve this, we would advertise it and we would have the position available only upon the start of school. If we did not start back to school, we wouldn't follow through with the HR action on it.
Would you actually advertise it? It's for existing people that we have in the
Not
district?
necessarily. You have some folks that are half-time right now
Yeah.
at 2 places that are interested in becoming full-time at one place, which means we'd be hiring full-time for another place. That's-
So you would just move that one person to do full
Instead of
time?
splitting them in two places, we moved them full-time to give the additional help through lunches and breakfasts and just the daily sanitizing, those kinds of things. That would put an additional person.
So you
a
could put
full-time
that
person.
advertisement off until 2 months from now?
It
just
would
to
still
see-
have to be an advertised job, and basically those 4-hour people would have to apply for it. I mean, we still have to follow the proper protocols of, and if they want to go to an 8-hour, they would be in the pool of applicants for that 8-hour position. Some of them may not want 8 hours. I mean, there's some people that like working their 4 hours. They don't want more than that, the 4. I mean, I think we have a couple of those, and they may choose not to do that. And so it would be hiring another 4-hour person essentially and making 8 hours in that building kind of is the situation would be that. I mean, that's what would have to be discussed with the hiring applicants and all of that if we go back to school.
But it is something we can, if we approve it, we can put it off until school starts.
We
If
can
it
put off anybody
starts.
starting work until school starts.
Okay.
Along those same lines, I suppose it does beg an interesting question that if we didn't go to a hybrid model and just simply postpone the opening of school, let's assume schools are clean right now, how does that affect the custodial staff if there's essentially no one in the school to make it
Well,
dirty?
at this point, we're still planning toward the opening as is. So we would need, it would be much like it was before. There's going to be sanitization, things that has to take place in those buildings, even though there may not be students. There's going to be staff that's going to be needed using the buildings. If we were at a home model, they're going to need to be in the building, in the rooms, pick up things, do things. So there's going to be continued cleaning and sanitization of the buildings. It's going to need to be ongoing because there would be numbers of staff. And I think if you decide to not come back, then we need to make that decision. Are you going to have staff come back and work independently in their classroom with no students or no one else in the room? Because there they have access to the technologies and those things. And then work with those who are truly going to need to be at home. So if there are people coming in the building, there's going to be need for cleaning, deep cleaning and sanitization in any building every day. Now, under that circumstance, we probably would not need to increase these 4 positions.
Mrs. Ellis, is there specific wording that you would suggest be utilized in the crafting of the motion to make sure that,
It needs to specifically state that the hours are being added for COVID-19.
Due to
And that
COVID-19.
the job duties include, extra, kind of a job description. So a custodial job description is, and that's just typing it up, I guess, in the minutes, but they just said, basically, like, what is that person gonna do? So they're gonna help with the extra cleaning, they're gonna help with garbage and cleaning the bathrooms and COVID-19 requirements, basically, that is being given to us by our state. So I am not a wordsmith, so whoever can word that better than I.
thank you, ma'am.
Any more questions, comments, discussions? Would anybody like to make a motion?
We had to take a stab at it, but perhaps it could be a team effort. I'd like to make a motion that we approve the adjustment to the 2021 final allocations to school councils as described in the attachment within our packet, specifically adding additional custodial hours to enable compliance with COVID-19 cleaning requirements.
If we return to school. Should that be in there?
Well, you can, or just know, that we know that that's what we want to do. If we return to school on or upon return to school on a full-time basis.
That's all I had. If you all want to have some specific wording to add to it to make it more precise,
You get that all done?
we could do that, or we could leave it up to Mr. Kristen. What do y'all think?
Are you okay with that, Paul?
I think as long as it has the COVID piece in it, I think that's what's most important. I'll second. Motion.
Motion by Mr. Heisel, second by Mr. Coleman. My brain stopped, sorry. All those in favor say aye. Opposed? Motion carries 5-0. Okay. Discuss and consider approval of providing of individual student school supplies for the 2020-2021 school year. Mr. Christie.
I wanted to talk to you about this because in the past, as you know, in the last few years, we, as a board, you have paid, you didn't give directly supply money, but you have paid for the copier leases at each of the buildings. In return, the money that was to be used for that, the schools have taken to purchase supplies. So we've been a district that provided supplies to all kids, general supplies to all kids. This year is going to be different. In the past, we were able to take that money. It's a total of about $130,000 is what that total amounts to in the district that we use to buy supplies for kids. This is going to be a different year. When they're back in school, they cannot share supplies. I think that's one thing Mr. Figueroa talked about. They cannot share supplies, so we need an action, to go one of two ways. We're going to need some additional support to purchase additional sets of supplies to go in the classroom so that they're not shared. I'm not sure that that's feasible. So the other option is for the year of 2021, to say, and allow the schools to put out a list of supplies that parents would need to provide. Now, this is a difficult time to be asking parents to start providing supplies. We haven't done it for 3 years now. So we're left in a tough quandary here of either the schools don't have the additional, and we're estimating that it's going to take at least 3 times that much if we provide all the supplies for the students in the classrooms in ways that they can be clean so that the kids can share when possible things that can be sanitized. Things like crayons and things like that, where we've been buying classroom sets. We bought multiple classroom sets, but not enough that every student in there has their own set. We've got to get to that point where the students return, they've got to have their own set, whether we supply it or whether we ask parents to do it. So I need some direction from you as to whether you're willing to put additional funds toward that to allow us to purchase the supplies for those students, or we do a directive and to say that for this year, because due to COVID and the kids not being able to share, that it's going to be up to parents to provide those supplies. Now, if they're at home, that's not a problem. It's just for the ones that are back in school.
Is this something we have to decide tonight?
No, I don't have to have it, but I would say that there are some things that are coming. As we get closer and closer to this time, we've got to make some pretty solid decisions on if we're going to be back in school full time. This is a question that's got to be answered. We've got to determine, because if we're not going to provide these things, we need the schools to start putting their supply list out. Now, these are things like crayons, pencils, papers, things like that. This does not include hand sanitizers, Kleenexes, paper towels, those kinds of things. We're going to provide that like we have. This is just those personal supplies for the students.
So for the students that elect or prefer to do virtual learning, are we going to supply anything for them?
No, at home, I think they're that would be difficult.
What will you do for K through 2? Because they're not getting
We're
Chromebooks.
gonna have to have enough supplies there that they'll have to share, and we're gonna have to.
But I'm talking about at
rethink
home.
the things that we're using so that they don't have to share things.
But the ones that are doing virtual from home. Because I know when we went NTI last year, my kids, they did send it home.
So I don't see any difference between,
Sending the
I mean, if they
Chromebook.
can't share it at school, then they need their own supplies. If they're at home, they need their own supplies. So I don't know what that does, you know,
So you think we
price-wise.
should buy it for the kids that do virtual? That's what you're
Yeah.
saying?
Well, I'm not saying that's what we should do. I'm saying they will need that. I mean, they will need those supplies.
I think you at
And I
least
think
got
the discussion
K
is,
through
do we
2.
pay for, you know, do we pay for that? But I don't see any difference between the kid at home, the student at home, and the student's classroom, they can't share their supplies. Not in this time. Yeah.
And that's why I put discussion on here tonight. I don't necessarily say that you have to give a decision and put a dollar amount on tonight. This is something that we've met with principals, it's been a conversation we've had about the supplies. This has come up, this question has come up. And I got it on so we can start the discussion here. So we're just gonna need some direction. So if this is something that you're interested in doing and increasing that budget, then I can come back with an exact number for schools.
Is it too much to ask if, what parents need it? You know, because I'm sure
Well, a lot of the
there's,
supplies that they have is driven by the curriculum. I mean, it's driven by the things that they do.
well, like the crayons and the pencils and stuff like that. If-
As you get a little bit over some school, it may be index cards, it may be multiple things, it kind of depends on the curriculum.
And that may all change depending on what we do.
Yeah, does the
Okay.
supplies change based upon if
Yeah.
you're in class or in virtual?
No, it should
Well-
not. If they're going to be doing the same work, should be doing virtually the same work at home that they're doing in class.
But K through 2 has no option.
They're in school.
Right. I mean, they're not doing Chromebooks at home. So they're gonna have packets.
More traditional,
Right.
PI type work.
Whereas
3
for,
through 12 will have Chromebooks and everything's more digital, not everything, but it's more digital.
It's going to take a lot of thought because there's just a lot more supplies. You're probably looking at 6 times more supplies maybe. I mean, you look at somebody, you take an art class and you got 30 paintbrushes, probably 120 kids could use 30 paintbrushes during the day. Well, now they can't. So now you need 120 paintbrushes in an art class. And I'm not sure, in music class, sharing music sheets, or I'm just looking at those type of things. And if you're in math class, if you're sharing, you know, anything else, you know,
Calculators,
what calculators, you know, a lot of people have classroom sets of calculators or things like that. I mean, there's just, that list could go on and on and on and on. I mean, you know, there definitely needs to be some sort of plan put together on how that's going to work if we are in school and how that's going to work if we're virtual.
And that's what I would like the outcome of this to be, that if you direct me to go back out to the principals and the teachers, we'll talk about exactly what materials are needed, and I can come up with a more accurate cost, because the curriculum is not going to look the same, and the materials that they use in a normal class condition is not going to be the same here. There's going to be some classes that won't even be able to be offered because of these kinds of things. So there are some pieces, and especially as you get to the older kids, there are some classes that can't be offered. Music, keyboarding, they can't share. And now it becomes very difficult to go in and sanitize those guitar classes, things like that. Those are the kind of things that make it difficult. But we're not looking for those types of supplies. We're primarily, at this point, we're primarily focused on your primary and intermediate grades right now. So where the largest part of the individual supplies are provided for students. There's less provided for high school students.
From my perspective, I think it's been nice we've been able to provide supplies, but I see we're going to have a lot of budget pressure this year from a lot of different areas. And I would see us going back in this particular case and trying to move more of the supply purchase back to the individual parents, and then reserving the budget that we have for those parents and families that are not going to be able to afford this. Hopefully, we'll be able to accomplish that through some sort of mechanism. That would be my perspective. So you know, kids, I mean, parents, families buy supplies for their kids. Kids put their own names on it, and that's their supplies, and they're not sharing, and that's bought for them. And so it would be sort of a return to the past on that. But I think it's going to be critical that we reserve enough in the budget to take care of families that are not going to have the resources to be able to do this, so we can have an equitable learning experience. So that's my perspective.
Have any of the schools already bought for this year, do you know?
No, but that's how it came up, we're at that point where we just normally start to order these type of supplies. And the question is, do we want to start trying to order these, or do we have the schools come up with a supply list that we can put out at different places of business where they would purchase these supplies like we used to do in the past?
Do we even know how much we're talking about money-wise?
No, I can't give you the figure right now. When we determine in the next few meetings.
Okay, Gordy.
They're looking at the bill.
Oh.
And I think we'll need, I need to know what that number would be before we can make a decision on it.
Well, that's kind of where we were when Paul and I were discussing this and going back and forth on, you know, do you want to do this or do you want to do that? I mean, we're just kind of at the board's discretion of what we were thinking, because we've been buying in previous years, but then this is not your normal year.
Yeah.
So it was kind of what the board was, where we wanted to go with it from here.
I mean, it could really snowball. I mean, I don't know how ATC would fit into this discussion, or even if it would, but like tools and, you know, everybody shares tools and ag classes.
Yeah.
You know, how's that all going to work? You can't share anything.
Well,
Do you even offer
there are
those
some
ones?
things that can be shared, but there has to be a plan to sanitize those things. Just like restrooms can be shared, but every hour they have to be sanitized. And so when you're using these pieces like we have here and the spray bottles, those go back in between classes, they would have sanitized, you know, the equipment. Just like we sanitize this, or with equipment, they go to the tool room, that kind of thing between classes before kids from one class went in. And I don't know that there are places now, the projects that when they're doing something at the ATC, that every student in there has to have skills on it. I mean, it varies. So we still got some things to work through on those. And there are some directives, like Mr. Stump said, we just received today, SPED directives today. And so we're going to start breaking those down. ATC has just gotten their protocols. Preschool at ATC also. That's another preschool and special ed got their protocols today. We got those today. They were released today, about 10 o'clock this morning.
The portion we're spending on supplies right now that includes hand sanitizer and similar, can that be identified and would potential request reimbursement for those items?
Yeah,
so that would free up about 130 for other things?
Certainly.
So what do we want to do? Just kind of,
There are things like additional hand sanitizers, mobile ones that can be moved from location to location, those kinds of things that we're picking up this time to be available in the building. Those are all reimbursables.
so we're not going to.
But I would like to see kind of the breakdown of, you know, for
Readiness will not be, I'm
the
assuming.
primary schools, you know, the elementary schools, and then what it would cost to support that, you know, those schools, the middle school, and then high school. I mean, I don't know if we could do everything, but, I mean, if we need to, you know, supplies to so many kids, I would want to touch the younger ones first. Oh, that's just, that's what I'm thinking off top. I really need to think about that and see where I can. You're just looking for a direction, right?
And we don't have one.
I didn't expect
We don't have one.
Yeah, you got 5 of them.
Yeah, sorry.
I mean, I guess just prices, and that was, especially K through 2, right?
Yeah.
Okay. All right. So, we're done with that. Are we done with item number 5? Anybody else have anything?
So you're gonna come back to us with some prices? Okay. Can we take a break, 5 minutes?
Yeah. Yeah, actually, yeah. Let's do 10-minute break real quick. Mr. Prado, can I see you for 1 second? Sure. Can I borrow you? Task force.
The others can hear me, I'll ask Greg. Ask him to come in, I'll go ahead and get started. This is going to be a quick and brief, not real in the weeds, we'll stuff this case kind of where we are on things and what we're doing. On the academic piece, since the last board meeting, we met on Wednesday, July 15th, we went over what the distance learning and the NTI piece, that'd be in two pieces, two different things. Distance learning would be that everyday stuff, NTI could be in short-term type things, if we were out for a few days or something like that. We went over that with here and with principals. We worked on two different plans, one for the hybrid model and the other plan that we're continually working on. I want to add, we're not just working on a plan that brings us back 5 days for some of the students and some of those being at home. We're also working on a plan that should something happen that we not be back in school full time, whether we come back for a day or two and we get sent home or we don't come back. So we are working on plans that would be a full-blown out-of-school experience, full-blown online. We met again on Thursday, July 16th, to review the re-entry plans. We asked all the schools with their staff, they've worked on some SBDMs and their staff to develop plans, re-entry plans. We asked them to submit those to us. We've gotten those back from every building. We went through those. We met then again that was an all-day meeting from 9 o'clock until 5 o'clock in the afternoon, just going through those plans. We met again on today to discuss the distant learning option with principals and administrators. We discussed we also worked on what the Chromebook rollout would look like, how we're going to do that, as well as the distance learning, what that could be for the students 3 through 12. We discussed the need to have, we'll be meeting with P2 to discuss what the learning will look like in those grades, because it's different, because as you know, there's not the technology piece with those. So we're working on that. We have another meeting set for next Monday, but starting tomorrow, those plans that the school submitted, we're taking a group of folks, and you're welcome to join if you'd like. We're going to meet here at 9 o'clock. We're going to the building. We're going to go through that plan as a group. All of our central office staff and the other administrators are going to join us. We're going to go through each building. We have 3 scheduled for tomorrow. We're going to do 3 a day for the next 3 days to get to all the buildings. We're taking their plan that they submitted. We're going to start that plan from the front door, taking the temperature. At this point, we're going with the temperature with the thermometer. And we would also discuss what that would look like if that plan should change tonight. And we're also going to be looking at their isolation rooms, who's going to do that, how they're going to man that, what gear they need, where they set those for. They have the plan, but we're going to go through a day, what a day would look like in that school. We plan on spending at least an hour and a half or 2 hours with each administrator on this first round. Now, we won't get everything answered tomorrow, but we're going to see, our goal tomorrow is to try to find holes, find problems, so that we can start as a group of administrators with their staff and their schools, and then with us here, start working on it, and us meeting with them in the buildings to see what we can do to help plug those holes. So that's what that group's going to be doing for the next 3 days. Special population subgroup, like we said, they just got their new guidance from KDE and CDC folks today. That was preschool, students with disability. Both of those were packaged together as one thing. So now we'll dive into that and start to look at what it's going to look like for support our SPED students and our needs there. And that will also involve the principals and the SPED teachers in that too. Where the local health department and district health coordinator participated in conversations on how to address the students with more severe disabilities. So we're working with the health department on those because there's going to be some special things for those. Let's see. The social health and social emotional health subgroup, they've been continuing their meetings online through all grade spans. They're working with their group made up primarily of assistant principals, family resource service centers, coordinators, school nurses, and school counselors. That's the group that's most effective with this one. So they're looking at the plans. One of the things that's come from this is we primarily during the day, somebody mentioned something about teachers checking temperatures during the day. We want these students that need temperature checks during the day, we want that to go to our nurses. I don't want to ask teachers in their classroom to be checking temperatures all day. This needs to be done by nurses. If someone is exhibiting, symptoms, they need to be sent to the nurse, contact the nurse. Those are the kind of guidelines that we're working on with that group. technology part, a large part of our meeting today with the administrators after the first part. The second part of it was working largely with technology. We've gone through the protocols for checking out the student Chromebooks. We're looking at the form, the sheet, the sign-out sheet. Thomas has that. We're looking at those. We're also talking about the conversations that we had with students and parents about a repair process. If a computer breaks down, what the process to go through there is. We're looking at some online things for parents that can be taught how to use the Google Meet and the Google Forms online. We're going to do some PDs for parents, but we're also putting all that together so that on the internet there's tutorials. And Justin can help me out. There's tutorials for parents already that vary from 1 minute or 2 minutes up to 15 to 17 minutes to help them through the things that they're going to be asked to do, that the students are going to be asked to do. The students can use those tutorials, but it's good for the parents to be able to see that too. That's all going to be online. That'll be part of the online platform. Permission forms, we talked about that. One of the other things that we're looking at is some things for our teachers. One of the problems that we felt we had at the end of last year when we were on the NTI, everybody, each school, because we had about a 48-hour window to turn it around, everybody had to kind of quickly triage and do their own thing. So this year, what we're trying to do, some of the days that's been front-loaded for teachers, is to do some PD training with teachers with technology, how to use some of these platforms and the options that they have. And our goal is to get these options similar at every school, so that one elementary school isn't using one platform and another elementary is using something totally different, or an elementary is doing something totally different than a middle school, because you've got parents who have kids in elementary, middle school, maybe a high school student. So we're trying to get that to where it's the same platform of delivery of instruction for a parent, no matter what age student that they have. We're continuing to work on that. As far as the internet access, one of the things that we're working on and starting, I did a webinar this week with all the HR folks from all of local businesses and industry, the industrial park. And one of the things that we're looking at is getting, I don't think we're going to be in a position to give the Wi-Fi or what's the word,
Wi-Fi? Personal hotspots?
Yeah, personal hotspots. I don't think we're going to be in a position to give personal hotspots to everybody that requests one, because I think we could be overwhelmed with the number of people that's going to say that they would like that. So what we're looking at now is strategically locating those hotspots. We're talking to businesses, churches, organizations throughout the community, maybe on the outer edges of the county. Let's just, for example, and we've not been there yet, let's say like at Fox's Grocery out in Trapp. Maybe we locate a hotspot there. It's on our internet service. It's not on theirs, so it doesn't affect their personal use of the internet. But they have a hotspot there. The folks that live in that area can get closer to that one instead of having to come all the way back into town to get information. So we're looking at strategically locating those hotspots, and we're looking to see how many we can go. Virtually every industry out in the industrial park has said we'd love to have one for our folks that work here, for the parents, the kids, or the parents that have students that work here for us. We'd love to do that. They're willing to turn that Wi-Fi to the outside at night to where anybody can pull in on their parking lot, they can access their Wi-Fi. In addition to doing their schools and turning the Wi-Fi out on their school parking lot, so all of our school parking lots will be hotspots also. So we're going to try to, and we feel that's a better approach than putting on buses and moving buses. It leaves the buses vulnerable. I will tell you, the bus that we had sitting out on the other end of town for advertising for drivers, we went and picked it up to clean it and do some things that we have to do to it. There were homeless living in it. So that's a concern when we start putting buses out somewhere. We don't have control. You can't lock them up, people can get in them. So we're trying to come up with another way to put these hotspots out there to make it available to parents and kids without leaving us vulnerable there. That's kind of I've got all my sheriff folks here, with the exception of Bridget. She's not here tonight. She's a conference. If you've got other questions, I would encourage you. I will tell you all. I'll be glad to send you the dates that we're having this task force meeting, and you're invited to come. If any of you want to come sit through it and see what it's like to sit through it and try to tackle all these things as things that these folks that stood at the podium tonight and spoke of, in addition to the concerns that the principals have and other teachers have raised, along with the concerns that we have. It's almost insurmountable things that you have to consider. You get into one thing and that leads you to 3 more. So that's what we're dealing with, that's why we're going to buildings to go through these things and walk through and start trying to see what else does that open up for us? What other concerns do we need to be addressed? And I guess another key point is we are planning for this system that you have asked us to do for the 5 days, but we are very deep into the plan of a full-blown, if we come in for a day or two, we get sent home for a week, 2 weeks, or a month, or if we don't come back at all, we're going to have a plan. We can go either way.
So with the recent increase in cases over the last week, there has to be a go live dead date of like, this is what we're going to do. I know we pushed start school back to after Labor Day, but as one of our speakers tonight mentioned, if the cases do continue rising, we have to go to all virtual. What, have we identified a date that we need to identify to make sure the teachers are prepared properly? Instead of, we don't want to wait until the end of August and say, okay, now we're going to go virtual.
We talked about that with administrators in our meeting today. As a matter of fact, we talked about that very thing. And in all fairness, we feel that we need to be able to give at least a 30-day notice to parents of what we're going to do. Now, the problem with that is if we continue down the path we're continuing down right now, and that gives us another week or 2 before we have to make that decision. And if we continue down this path and we keep going, and the numbers continue to increase, that decision may be made for us at a date later than closer than 30 days to start school. I mean, I think there's a possibility this could continue and there could be a decision. I don't think KDE, CDC, the governor's office is looking at start dates. I think they're looking at points when they think it's, they need to make that call. So I don't think they're going to be fair with us and give us this 30 days maybe in advance. I think it's subject to change as the further we go. I think this next week will be very telling as to the direction of CDC and Governor's Office and KDE. Understanding we now have a new commissioner too at KDE, new commissioner of education. So I've got my first meeting with the new commissioner tomorrow. It's a internet meeting, so Google Meet.
Well, I know the committee is looking at, the different plans, hybrid model, going all back to
Madison
school.
County, Montgomery County, but I will say Bourbon County was also. I meet regularly with these superintendents, Harrison County, Robertson County, Bath County, Brown County, in this general vicinity. All of the superintendents, we had the same, we came to the same plan. We came back to the table from boards with the same direction. We were all working under the same auspice, and that's changed now. And I'm afraid when Jefferson goes, and then when Fayette goes, if they do, and now having, as was mentioned tonight, and now Bourbon is there, you start to see the dominoes fall. So we're preparing for either way.
So your suggestion is, as a board of our committees, everyone, we need to be in agreement by the 1st of August.
By the 8th of August, I think we need to be set on what we're going to do.
Move forward with that plan.
Move forward with that plan unless directed by somebody on a higher pay scale than us.
So with the surveys that we've gotten back, has that changed your outlook on how we go back to school?
We've even surveyed the subs. We have about 100 subs. Well, we have, odd enough, we have exactly 100 subs. And we got 70 of those responses back. Of those, 59.
About 57 wanted to
57 said they were coming back. And of that 12 that said no, there was 3 of them said, I want to wait. All of them said, keep me on the list, but I want to wait and see how things go. So there's some nervousness there too.
We have 9 people that have applied and they're coming for orientation, so I assume they want to work, so.
We're getting ready to do the orientations for 9 additional subs, which would put us up to about 65, 68 subs that said they were going to come in. A lot of the questions that's coming are questions that we're trying to answer, and a lot of the questions that we're still getting from the schools. If you look on the website and go through those questions, you'll see the answers to those questions as we answered at this point. And we're going to continue to do those. And now as the principals submit questions from their building, we're working with principals and we're working in our groups, depending on which group it is, to answer those questions. And we come together as a group before the questions their answers are sent out to make sure that we're all together on that. Now we're having principals sit in with us for this stuff too, because now they're bringing some questions, so I want them sitting in on it as we go through the answers to these questions, so that everybody's on the same page with their understanding of how these things will be addressed.
So we got a pretty detailed, I guess, survey kind of thing from one of the principals. Are they all doing that with their teachers to find out how they feel about returning back to school and what the issues they might have?
I think
all of them are doing?
Most are, yeah. We had a conversation, but some have said, I'll do it, but I thought that's what we did, you know, but they're working on that. But the questions that we got from that one were very similar to the ones that we're getting every day.
Right.
And some of the very questions on that particular survey are answered on the webpage. Exactly what happens. Now, one of our next principal meetings, I'm going to have the health department, CDC folks come in and talk to the principals and answer the questions there. And I will be glad, and I've talked to them, they would be glad to come here to this group to speak too about our plan, the things that we have in place, how we're going to do things, what we're doing, and be glad to talk to you about that. They've offered to come here.
So do we think we need to address maybe a special meeting that first week of August to determine, because that's not on the calendar.
Well, from my perspective, I think we're not going to do anything the 1st of August. This is going to be such a fluid process. I think you all are just going to have to, as you're already doing, plan for a lot of different contingencies that aren't just A, B, or C, you know, with hybrid things that, you know, it could be that we'll come back with certain grades are actually going to do in person, then you might exclude other, you know, older grades. And it wouldn't surprise me if you all end up having to do something like that and change plans several times between now and when we start. We're just going to have so much patience with this and let the, you know, let the disease and the needs of our children and our staff, you know, that certainly has to be key in the whole process, and it's changing on a week-by-week basis. So, you know, you all are going to have to, unfortunately, plan for a lot of different scenarios. One of the things that I thought was interesting, I saw that Bowling Green Independent Schools are doing, I wish we could at least consider, is maybe they're going to take their first week and they're going to bring just half of their people in for the first week as sort of a soft opening of their schools. I'd at least like to throw that out for consideration. It's a long time between now and Labor Day. You know, potentially you all might, you know, as we get closer to it, say, well, maybe that's a scenario we ought to look at. Maybe instead of starting Labor Day, start the week before for just half the people. So, you know, you don't have, if everything starts to line up, it's still going to be a challenge if the cases are down by the time we get to Labor Day, having boom, everybody come in on day one. Might be something to look at, you know, for y'all to kick around and see if that would be a useful process. And I will be curious to know later on, after y'all talk to the health department, what the scenarios will be, because there probably will be cases that in the schools to what the quarantine restrictions are going to be.
Again, I can tell you what the local health departments are going to do at this particular point in time if there's a case in the building. The protocol that we have built in, that we put out on our website and we put out with the principals to share, is when we check temperatures. The first time that the student's temperature is elevated to greater than 100.4, parents are called, they're sent home. They have to remain at home for a minimum of 72 hours and be fever-free without using fever-reducing medications. Then they can come back. When they come back, the parent has to accompany them back. We check the temperature. If their temperature is normal, then they can proceed and go back to class. If it's still elevated, at that point, they go back home with the parent. They're given a packet from the health department with instructions on how to seek medical attention, where they can go for testing, those kinds of things. And the health department, we turn the name of that student over to the health department, and the health department makes a contact with that parent of that student. They can force them to be tested. We can't. They can ask them to be tested. If they test negative, then they get a doctor's note, they're able to come back. If they test positive, then CDC or the health department takes over totally at that point. They determine from our bus seating charts, from our room seating charts, who, in their opinion, has been exposed. And their definition of exposure at this point is students without masks within 6 feet for more than 15 minutes. So anybody that meets that criteria has been around this student without a mask for 15 minutes or more will be required to be tested, quarantined and tested, and either quarantined or can come back.
So the health department, if
They do the contact tracing.
they'll figure out the extent of what the quarantine requires.
Exactly. They do that. We don't set that. We don't determine the contact tracing. That's our health department. And their folks from the state government has been contracted to do contact tracing now. We do not do any of that. We provide them with any information that they need, including seating charts, those kinds of things, and they make the determination from there. Now, our buildings are videoed, so we can, they have the option of going back and reviewing videos, their buses are videoed, those kinds of things. So we have more information probably to give them than a lot of places will, than a lot of businesses will, a lot of other folks will be able to give. Because a student, especially in elementary school, a student may not be able to tell you who they sit within 6 feet of on a bus, but we have video and we have seating charts on the bus that we can pull up and we can look at, that we can turn over to them and they do their contact tracing from there.
On the distance learning, I think it's a pretty reasonable speculation that we'll have a certain sector of students that'll want to be completely virtual, and then hopefully that can be matched up with a similar group of teachers. Do you envision for most classes, and it'll probably be different depending on the grade level, that will be classroom instruction is essentially live, so that you have a teacher in front of a Google Classroom type situation, you've got interaction all throughout the day?
That's something that we're looking into. We've got some hoops that we have to jump through as to what that does, especially having the students and having access for people to see what the students has going on in their background, so we've got to work through that. We've discussed that. That's something Mr. Kaysen and I and his team we're working through. We're also looking to definitely provide the option for staff to take their lessons and maybe even take them in smaller increments to where the meat and potatoes of the lesson, the 10 to 15 minutes, is what the crux of that is that they kind of fixate on. And then at that point in time, that gives, whether you have parents who work until 6 o'clock at night who want to be able to help their child, they can review that at different times and points through the course of the day. So there's several different options that we're looking into. Some of this would require other teachers to assist in the filming. Potentially, some of it would not. It would just be setting up and being able to push a button, kind of go through that process, and that's kind of what Mr. Casey and his team and I are working through to kind of come up with different scenarios to maximize the best learning. That's what's different. By and large, that's what's different with this as opposed to the emergency NTI. That emergency NTI, you have 48 to 72 hours to put a plan in place, and with this, we've got time to be able to work through some of those things, come up with something, which is why this is going to be distance learning, not an emergency NTI situation.
And getting back to the 1st of August, and this, like Mr. Christie said, our decision may be taken out of our hands. It may be, it may come from the governor's office. But if the cases continue to rise, and I just think it's imperative, if we do decide to go to virtual learning, that we give the teachers, the students, the parents enough time to prepare, for labor, to do that.
That would dramatically change what that 8 days looks like for teachers prior to start of school, what they're working on those 8 days prior to the start of school. That would dramatically change what the instruction to the teachers are, what their professional development possibilities could be. Maybe a totally different set of thinking. That's what we're able to look at both of those.
So I guess what my thought process was, if the decision is still ours at that point, the board's decision at that point, if it's still in our court, we need to make a decision if we're going to go virtual learning. And if we don't, then, we can continue down a hybrid model, whatever is in place. But if we do decide and the cases drop, great, it's fantastic, from August to September, it's fantastic, but we've already planned to go virtual for a period of time. I don't know, that's my thought process. I think we do need to we should make a decision if it's still in our hands by sometime
That's
early
the way
August.
that we were seeing it too, and we've had a group discussion, is that we're coming up with several different scenarios. We can drill down deep enough to give us an idea. That's where we were all, as a group today, kind of talking about, it would be nice to be able to have that decision that's made, if possible, to where at that point in time, we can still have the drill down points that we have for these other points, and we can say, this is the one we know we're going to focus with, and we can just start growing. And we can get the smallest of details that we possibly can work out, knowing that when we walk in on that first day, whenever that is with teachers or whoever is there, we're still going to be working through kinks and that type of thing. But at least that gives us that focal point to say, this is what we're going to focus on. And that's what we were kind of discussing today.
I'm fine with doing the meeting first of August. I think we're going to look into possibly doing it, but do you want to do it in person or?
Well, I think that'll be determined by next week, so whether we're back at a group this size or whether we have to go back to some other form of meeting, I think that may be determined for us. I'm not sure about that.
Because today, what was announced, 10?
Well, I think the governor today went back to the 10 groups of 10, but I think it was, I want to go back and watch it again. My understanding of it was a lot more for the social gatherings and those type things, but there might be some exemptions for businesses and some things like where we're seated tonight. I don't know, that was a very quick snippet that he threw out there. I'd like to see, I figure we'll get more detail on it tomorrow.
I didn't used to watch it all, so I didn't know.
I just saw the snippet come across, I didn't get any details on it.
And he said one way, but then the bar across the bottom said gatherings limited again, so he didn't say what just social or what it was, but he did specifically say going backing up from the 50 to 10 again, and they did a travel, it wasn't a band, it was they worded it, but they listed 9 states, they're not recommending travel.
So you want to go ahead and schedule a meeting now?
If that's agreeable to the board, and that's,
Gordy, you're being quiet.
Just because I've got a lot of questions.
Okay, well, are you good with the August meeting, or are you not?
I'm good. I figure we'll probably have to meet twice before that. I don't know.
Might have to be twice after that, too.
Yeah, we just got a lot, there's a lot out there right now. So, I mean, a lot of work that has to be done by this district. And I guess I want to go back first. I mean, I don't know if you want to try to pick a date right now or let me go on to my questioning or whatever you want to do. I mean, I've got some questions for Mr. Christie that I want to get through here too. I know you went through these committees really fast when you were doing this right here, but could you go back again and tell me what committees we have working right now?
Mr. Holland is chair of the academic committee. Bridget Mann is chair of special populations. Christy Bush is chair of the social emotional health. And Donald is chair of the logistics.
And then there's another
Now,
main
the other-
task force.
That, they make up, those are subgroups of the task force.
I guess that's where I'm at. All right, you've got 4 committees right here. Can you tell me the makeup of these committees? I don't care about the particular person, I just want to know
I'll let each
how many
name
central
out.
office,
They
how many
probably take quicker
administrators,
than
how
I
many
can.
teachers, how many parents you have on each one of these committees. Is it different for everyone?
I have counselors, assistant principals, FRCs, and nurses.
How many do you have of each one of those? And what schools are they
I
from?
think there's about 18 total. I have to look at the invitation to get the exact amount.
And what's the charge of your committee?
Right now, we're thinking of scenarios that will happen if we start school, what a child might encounter since we've been out, the emotional behaviors that they might come into school with, how to either deflect those or make a plan for those.
And how many times has your committee met since you started?
We've met 3 so far.
Met 3 times.
We try to meet in between the task force so we can bring things to Mr. Christie and then have discussions when we come back to the next meeting.
And do you keep minutes at that meeting?
Yes,
So those minutes would be available to the board as well?
yes, sir.
All right, academic.
So we have 7 members on. We have 3 principal reps. We have 4 district reps. That's not where it's going to stop. We'll be bringing in teacher reps as well. Currently, we've asked the principal reps to kind of survey and poll some of their staffs to give us some feedback with that so that we can proceed. And we've started with ours. We've gone through the NTI application process into what NTI would look like, their Chromebook application, as well as the learning distance, what that would look like 3rd grade through 12th grade. And then Monday, we're going to approach what that would look like from E through 2nd grade without Chromebooks. And we've met 6 times.
And do you keep minutes in that meeting?
Yes.
And you pass those meetings on to the task force, and you would have those available as well? Special populations?
I'm sorry, she's like.
Special
That's
population,
Bridget.
Bridget isn't here, make up her, she's probably online, but
She's texting me. Special ed teachers, GT teacher, related services provider, SLPs, OTs, principals, and psychologists. That's who she's.
You all know how many teachers she has on that,
She did not say.
or where they're located? Logistics?
19 members. I have assistant principal at the high schools, 2 elementary principals, FRC folks, several teachers, nurses, SROs, food services, transportation folks. That's pretty much the gist of it. HR, finance, I'm sorry, HR, finance, it's a pretty eclectic bunch.
And you guys keep minutes to your meeting as well?
Yes.
And those are passed on, and those will be available to the board as well?
This Friday will be our 5th meeting.
You've got 4 times right now? Now, I guess the part that keeps getting me as a board member, because I keep getting emails, text messages, and things like this, is people not communicating with teachers and people out in the district. And if we've got minutes of meetings and things that are happening with concerns and everything that we have there, why won't we just go ahead and publish those so everybody can see what is there, and that way this will answer a lot of different questions that they have. If we know what teacher is on a special population committee, then we've got a teacher that knows who they can talk to at that point, and they know the things that have been discussed at that time. When we've got people that come in that have concerns, if those things are printed and those things are out there, then I think that answers a lot of questions for us. I keep telling when people write me, check back with your teacher members, check back with your principal, check back with whoever your representative is. But, I don't know how long we've had committees, but this is the first time I've been able to write them down and to figure out what's going on. And there seems to be a lot of confusion from some people that are on committees about exactly what's happening in these committees. But each one of these committees should have a charge, and that charge should be going to that task force each time to help us in making the decision that we have to make. It just seems like to me, we go through the night and not criticizing Mr. Christie on that, but I mean, he just goes through really quick everything we got, and all that we have is just what we've heard here tonight. I don't have anything in writing. I don't think it's too much for this board to ask each time, tell me what you have found and what you think we're doing at this time. And I'm gonna go back again, Mr. Talby's talking a little bit about we have to make a decision. No, we don't have to make a decision. This district has to make a decision. We are not in the school buildings. We do not know what's happening. These people should be talking to these teachers every day and knowing what their concerns are. It doesn't make any difference if I want to come in 5 days a week with every kid there. If I've got 20% of my teachers that don't want to come in, then we've got an issue and we've got a problem that we've got to do. And it just seems like to me that we're hiding information for no reason. I'm not saying we're doing it purposely or anything and all like that, but in this time right now, everything needs to be open. And everybody needs to know what's going on. And many of the questions and concerns that we heard tonight should have been answered a long time before this. I'm sure these committees have been in place a month, at least, or more. So we're going to have to up the communication. And people are going to have to see, because we're getting in that time right now to where we're really going to have to be focused on what we're going to have to do and how we're going to have to do it. And people, we don't need to make people adversaries. Like, I'm not going to come back to school, I don't care what they say. I don't know what, well, maybe that's not what we're planning. But let's don't put somebody in a position that they don't know, so therefore they want to be adversarial about it. But let's make sure that we're talking to people every day. We're putting things out there every day and people know. I mean, I really felt like last week when I asked that committee reports be put on the agenda, that we would actually get a committee report of what the committee has done. And I really thought tonight that we probably should have got something. This is what has happened. Guys, if it's not written down, it's probably not going to get done. And we've got to be able to do that. And that's the only way that we're going to be able to pull everybody in so everybody can see what's happening.
We'll start sending out the regular documentation of the agendas and the minutes from the meetings.
I think it'd be great to put them on your website. I think people should know. I think, parents should be able to look out there. This is what we're thinking. These are the biggest concerns that we have right now. And many of the comments that we heard tonight, these are things that should be on there. People need to know, as I've said many times before, we've got a range, not only in public, but in your school system, from I'm scared to death to do this to I don't care, I'm fine. That's the range we got, and that's difficult to deal with. I don't envy the decision to be able to go in there and do it and to figure it all out. It's a tough thing, but it's going to get tougher if we don't include everybody. And we've got to make sure that, and that's probably one of the first times in education, most of the time in education when I was principal, you get people together, this way we're going to do it. Okay, Mr. Sizemore, you don't like the way we're doing this? I'm sorry, this is what we're going to do, okay? We're not like that now because I don't know what the right answer is. I don't think anybody knows. I don't think anybody can sit here and say 5 days a week, everybody there. NTI is the only thing we need to do. Every situation that we put out there hurts somebody and helps somebody. We have got to be everybody on board for this whole thing.
Is that the end of your questions?
Well, if the information will come out, I'm fine. I just want to make sure information comes out right there. I mean, I think there's a lot of confusion about what's going on in committees, how much is being listened to in committees, how much is being passed up. Some things, I've heard all kinds of different things, but I'll just leave them where they are and let's just get started from here doing it right.
Still like to schedule a meeting first part of August, if the board approves that.
good with that. Is there a certain day you wanna look at?
Third.
You're ready.
Well, for the following Monday, I mean, what, we can do it that later that week. It doesn't have to be on Monday.
I'm good on the 3rd.
You prefer to do it later in the week?
No, I'm fine with the 3rd.
Yeah.
Okay. August 3rd? And do we want to have updates from the committees on August 3rd? Is that what you're?
I'll start sending those out as they meet, we'll start sending out, but we'll start doing that.
I think we
don't
need to
have
have-
the next meeting, we can start that.
I'd like to go ahead and have what you have right now. You got minutes right now to be able to, for board members to see.
6:30.
6:30?
When you met, what the minutes were,
The hot water.
how you addressed your charge.
Hopefully when the hot water issue is.
Mr. Christie, we worked any with Cognia on this? Used to be Advanced Ed, that I know we're a member of it. I talked to some personnel from there, and I know that they have developed surveys for parents, teachers, and students all the way through. I think we've used them for CSIP before, and they'll do reports for you. And I know we've surveyed or whatever, but I know there's some questions about how well our surveys went. I don't know who did our surveys, where they came from, if those were in-house made up, but these are professional surveys that have been done, and I know we're a member there, so all those services, I'm sure, are free. But there's a really good section. There's only so much that I was able to do, because the rest of it, you have to be a member to go in to see everything else is there. But it looks like they've got some very good resources, and it's definitely something that they're very well respected. It used to be Advanced Ed, now I think they went in together with something else, so they're Cognia now. But some of the stuff they had sounded really, really good, and I'm not pushing it, I'm just saying that's a possibility.
Good on
I'm
August
good.
3rd? Scott, are you good on August 3rd?
Yep.
Brian?
He gave you the thumbs up.
Okay. I'll say you might fell asleep on the Brian on those. Okay. If that is all the questions, then we are on item number 7. Consider approval of second reading of policy updates. Mr. Christie.
Would ask for a motion to approve policies as presented in the first reading. There's been no changes to anything since you did your first reading. We've already approved procedures. Policies take two readings.
Any discussion?
Move to approve second reading.
I'll second.
Motion by Mr. Peridot, second by Mr. Colby. All those in favor say aye.
Aye.
Opposed? Motion carries 5-0. Item number 8, consider approval for new building level clock system at Stroke Station Elementary School for $18,321.92.
Yeah, the board asked us to bring back to you at some point in the very near future additional quotes for the clock system at Stroke. Originally, this summer, when we presented that to the board, there was some question with regard to whether we need to go with digital or analog clocks in the school. I had reported to the board that the principal's preference was digital, and the board directed us to go back and get quotes for both digital and analog. Those quotes are in your packet. Basically, there's a $6,000 difference between analog and digital. $12,000 for the analog, 18 change for the digital. So we're just asking for the board's direction to either direct us on to what to purchase or table that at some point in the future. But it was on our summer project list, and the board asked us to bring it back, and that's what we're doing now.
Superintendent's recommendation.
I would recommend go ahead and put them in, but I would tell you all new buildings we built, they've been analog.
Well, that's what that's basically my question.
They're
Your
analog.
recommendation to go to analog, so all I want to know.
They're analog in all the other buildings, they're digital.
That's your recommendation.
My recommendation would be analog, saving $6,000.
Now, do they have clocks that are working now, or?
They have some clocks, one side's working, the other side isn't, but they're scattered throughout the building, some working, some not. They're pretty antiquated, we can't get parts for them any longer, repair them. That's why they're still broken, because we just can't get the parts, they're very old.
Digital replacement.
Okay.
Is there any tangible benefit to a digital clock besides personal preference?
I would have to defer that to Mrs. Shirok, she's the one that requested the digital.
I think it's just the exact time. I think, I think what was explained to us the last time was that in elementary, they like it to be able to teach kids how to tell time, whereas the digital is pretty much the norm for, I think, high schools and stuff that change on a schedule and do some of those type of things. But that's why I want the superintendent's recommendation on that, if the rest of them are analogs.
Any other discussion? Not anybody like to make a motion?
I'd like to make a motion that we approve the purchase of analog clocks at a cost of $12,895.91
Motion by Mr. Heisler.
for Strode Station Elementary, just to clarify that.
I'll second it.
Who was that? Was that you, Gordy?
Yes.
Okay. Motion by Mr. Heisler, second by Mr. Peridot. All those in favor say aye.
Aye.
Opposed? Motion carries 5-0. Consider approval to replace and repair chillers at Robert D. Campbell Junior High School for $160,000. Mr. Stunt and Paul Christie.
Several weeks ago, we began experiencing alarms at our chillers out at Campbell Junior High School. We tried to repair, to diagnose what was going on with the chillers. We could not, so we called in a company, Thermal Equipment, to assess it. They reported to us that we had one of the two compressors out in one of our chillers and several motors that were fried. Alarms do not go off in those chillers until they lose about 4 of the 10 or 15 motors that are in each one of those chillers. So when we got quotes for those chillers, to replace the compressor and the 4 or 5 pumps was in the neighborhood of $30,000. Given the fact that those chillers are about 17 years old and use R22 refrigerant, which is no longer made and very difficult to get, we thought it would be pertinent to bring to the board the option of purchasing new chillers and to bring cost to you of what it would cost to purchase new chiller, at least one new chiller for the building, and compare that to the repair cost of about $30,000 to repair a 17-year-old chiller on site that uses the refrigerant that's no longer available. So we generated quotes from Carrier and Daikin. Those quotes are in your packet. In the interim, over the last 2 weeks, the second chiller went down. Both chillers were out today. So we were attempting to diagnose the problem with the second chiller. I haven't gotten those determinations back yet. But both chillers are the same age and both have the same conditions. They're both trained chiller systems. The quotes on your desk basically tell you that we can buy 2 new Carrier chillers for roughly $101,000. These numbers off the top of my head. That's roughly $55,000 per chiller. I quoted $30,000 to repair one a little while ago, $55,000 for a new one, another $14,000 to install it with the Carrier chillers. The issue with the Carrier chillers is that for about 10 to 12 weeks out on order. If we start school on the 8th, we have at least 1, possibly 2, both chillers out in Camden. I was told today, however, that one of the Carrier chillers is available to us immediately. The other would be several weeks or multiple weeks out. With regard to the Daikin were a little more expensive. The Daikins are the chillers that we put in Baker and Strode here recently under our energy conservation project. The Daikins are a little more expensive. However, they come with covers that cover the coils for hail damage and things of that nature, protect a lot more protective equipment on those chillers. I had a question by, both of those chillers were quoted to us for $130,000, which was about $65,000 a piece compared to the $55,000 for the Carrier. Mr. Heisel submitted a question today to us regarding energy efficiency or the projected energy costs for each of these units over the course of the year. I submitted those to him in response to his question, but in that discussion with the vendors, Thermal, who is the vendor for Daikin, reduced their quote by $19,000. So the quote now that they submitted to us for 2 new Daikin chillers is $110,000 for 2, with $29,000 installation as well. So based on that information, we're asking the board's guidance to either prepare as an option 1 the 17-year-old chillers at a cost of about $30,000, to purchase Carriers, which may or may not be ready for the beginning of school if we start September 8th, or to look at the Daikins, which are available now. One will come off the line July 29th, another Daikin will come off the line August 10th. So they could be installed before the September 8th deadline, but a little more expensive. However, one other additional information I could offer you is if we want to start school on the 8th and the chillers are not functioning, we can lease a chiller off of thermal equipment for $14,000 a month until the new ones come in if you wanted to go with Carriers.
What's your recommendation?
Buy the Daikins. At a cost of $110,000, another $30,000, to install it, $140,000, you can have brand new chillers inside. They'll do for another 20, 25 years easily. More efficient systems, more reputable systems. They're available now, you don't have to worry about lease rates. It seems like that's the best option.
Having the second chiller go out today throws a monkey wrench in the whole dynamic.
Well, it went into alarm today, and we're out working on trying to diagnose what's going on. But both are in alarm. And
The fact that we don't really know whether it's, what's wrong with it.
the second one we don't.
The fact that thermal equipment came in and reduced the price of the, how do you pronounce it, Daikins. I mean, is it fair to who's the vendor on Carrier? I forgot. It's not thermal equipment.
I know the person I speak with, I'm not sure.
Koch Air. I mean, is it fair to Koch Air to let thermal equipment come in at the last minute and drop their price and not give Koch notice that their competitor has dropped the price over the weekend?
What I'll say in response to that is I contacted both vendors today and spoke with both individuals, and they both had the same option. I asked them for the energy efficiency numbers, and the Carrier rep could have easily reduced his price as well. I shared no additional information between one and the other.
Okay, so they both theoretically had the option, since all this is online, they could have looked at the two quotes. You talked to both of them today, and Koch could have said, you know what? Independently, they could have said, we want to reduce ours.
They had the same option, or I said opportunity, I should say.
How much R22 refrigerant are we talking about, and what's the cost of that on today's market?
I'd have to get back with you on that. I really don't know what the current rates of R20. I know it's in high demand. They don't make it anymore, so the longer we go, the more in demand it is, the higher it goes. But I don't know the capacities of those machines compared to R22.
If we end up replacing one or both of these, will they recover that R22, and is that then the property of thermal equipment as part of their installation?
No, they've offered to buy both chillers back for us at a cost of $2,500. They would pay us $2,500 for the old chillers.
Does that include, and including the R22 that's inside them?
Yes.
But I guess they would drain that out or pump that out or whatever they would do.
That would be part of the 30,000 contract for install.
So a chiller, since I don't have a chiller in my house, but a air conditioner. So a chiller, it's got, it's utilizing water flow to do some of the chilling of the refrigerant, for lack of a better term.
That's correct.
And then you've got fans that are accelerating that, but you still have a compressor in there.
You have 2 compressors in each unit.
So the parts that could go bad, going back to option 1, if we replace the compressor, and let's say we replace all the motors, what else potentially would we have to replace? We run the risk that we might have an R22 leak. We don't know what the cost is to completely pump that out, but I'm trying to think, you know, since the structure is there and the piping and the installation's already there, even though we're repairing a 17-year-old unit, what portion of the real working parts of a 17-year-old unit are we bringing up to being brand new? So potentially, are we, you know, it's like if you took my 16-year-old car out that I have out there and put a new motor in, that still leaves the transmission and a bunch of other things. And I'm thinking the chiller, you replace the motors and the fan and the compressor, you really got a lot of it. You really almost built yourself a new unit up on it.
You're still leaving out the rear end, and that's your coils.
Any idea what coils cost to replace?
I would have to get back to you on that. But I think the point that needs to be said is that if you repair your current train units, then at some point, you're not going to be able to buy refrigerant to regenerate those chillers when the need arises.
And I'm assuming there's not room in the maintenance budget for this. This is all coming out of the contingency funds?
I think we probably would have to go through a BG1 process, and you would have available the option of doing using construction bond for the money to purchase these. I'm pretty confident KDE would require a BG1 for this, if you were to choose to purchase the new chillers.
But suffice to say, it's not just coming out of the budget, out of the maintenance items.
That's correct.
It's either coming out of contingency or we're having to tap into construction funds, and thus we couldn't use them for other projects.
I think that's a correct statement. There's no way that the maintenance budget could entertain $140,000 emergency expenditure. We did not budget for that.
The train unit that's sitting on the roof, let's call it train unit number 2, the one that we're having questions about today, is that used anywhere else that those spare parts might be helpful at another building?
No, we've got, all our other schools have new chillers.
We haven't got a new chiller at Shear?
Yes. No, chillers, Shear is heat pumps. Geothermal. Preschool is window air conditioners.
So does that school just have the 2 chillers?
I'm sorry.
And does it just have 2?
It has 2 chillers out back, on the fence around back.
Okay.
There's 2 huge chillers. The compressor is the size of the car engine, to give you a sense of what's going out in it. There's 2 of them in each unit. They have a crane come in and put a compressor in there.
I was hoping the efficiency numbers would prove to be, you know, really help make this a slam dunk, but it looks like the electricity cost is, if I've interpreted these numbers correctly and plugged them into the correct website, it's only about $6,000 a year or something like that to run these, which seems low. But the difference is maybe between the carrier efficiency and the Dalkin 10 or 15% or something like that.
The Dykens are a little better efficient, a little more efficient based on that chart. But they make a higher efficiency model, but it's 12 weeks out too, and more expensive.
So this is not the Trailblazer high efficiency.
It's the Trailblazer standard model. It's not the high efficiency.
The AGZE?
That's correct. The high efficiency on your graph is the one with the very top, the red with the squares. That's their high efficiency model. And that's not available for another 12 weeks if you want to purchase that. Of course, it's going to be more expensive.
And having the same units, the different things, that I've got to presume this helps in terms of maintenance?
Do you mean at the other schools?
Yes.
Absolutely.
Familiarity with her.
Absolutely. That's why we bought all the same model lawnmowers across the district for the same rationale. When you buy parts, you buy them for the district, not just for a single unit. That's a good point.
Won't take any different controls on the inside?
No.
Just the chiller?
Using the same control systems.
Controls have been updated there.
Yep.
Since this was the original chillers.
Now, when it says the startup services aren't included, what would that include?
Mostly, they show us how to do that. They'll start it up and run it, but they'll just show us how to maintain them and run them throughout the course of the next 20 years or so. But the company that installs them start them up.
Okay.
The manufacturer will make sure that I think the quote probably is the manufacturer comes in and starts up as opposed to the installers. It's not our responsibility to start them up after they install. They'll be turnkey like they were at Baker and Strode.
So the installation for either Carrier or Dalton is exactly the same price down to the penny?
Great observation. You're correct. They are the same for both.
That's pretty insane. Is it? Make sure we're going to say conscious supplying the Carrier, but who's installing the Carrier? Thermal?
Thermal.
Oh, there we go. That's why.
Yeah.
Thermal's on the state bid list, and we get them for like $85 an hour,
That's
which is really low in this field. Really cheap.
I'm ready to make a motion.
Okay.
I'll make a motion to approve option 3, replace both chillers with Dawkins for a price of $110,000 for that reduced price, including the installation of $29,206.17.
Plus the installation.
That's an installation. $29,206.17 is the installation. For both units, right? Yep.
Okay. Motion by Mr. Tobey, did you get that on that, Ms. Long? Okay. All right, motion by Mr. Tobey, would anybody like to second? I'll second. I'll second. All right, all those in favor say aye. Aye. Opposed? Motion carries 5-0. Okay, item number 10. Discuss and consider approval of purchasing thermal temperature imaging equipment for all schools. John, you're up again.
We have folks from Control here to entertain your questions or any comments you might have related to your experiences with the equipment that exists in the hallway. So I'll just turn it over to the Control people.
Hello again, everyone. I'm Bobby Clyber again with Bait Security Sonatrol. So first of all, thanks for having us back in. I did want to point out that one thing me and Brian were discussing is, for anyone that wasn't here, what we're talking about is putting in a piece of equipment that is going to help streamline a procedure that we know is going to take place for you all if you do decide to move forward. So with that being said, some of the concerns that came up with the system solution that we provided last week was the accuracy of the system, the actual time that the system was going to take to read versus handheld units, actual cost savings versus the cost of the system installation, and then there was a mention that a demonstration of the system would be good to have. Did I miss anything from the last board meeting?
with concerns? Okay. So with that being said, we did provide a demonstration at the beginning of the board meeting tonight. We got here early and set everything up with a tablet installation inside of the room and the large automated system on the outside. And the intent of the demonstration was to show you all an actual look of what this equipment looks like. We wanted you to be able to see the function of the system and hopefully be able to see the accuracy of the system, as well as being able to see what it was going to take from your team to be able to run something like this. So with that being said, some new information revisions that we have done to our proposals, and thinking through the process a little bit more, maybe being able to remove some of the extra items that we had on the proposals, like kitchen entries, and focusing more on just getting the students in there, still with an emphasis on parents coming into the buildings to pick up students. So with that being said, I know it's a long night for you all, and very appreciative to have us in. So we just have 5 slides. Hopefully we can get through this 5 to 10 minutes, unless there's any questions that you all have. So with that, the first slide that we have is just a quick showing of the handheld unit, which I have with me if anyone saw out there in the hallway. Handheld unit versus the automated unit. And what you really see there is what a simulated line is going to look like to run this. So the S stands for screener. So essentially what we're saying is with the handheld unit, what we've heard most people say is about 7 people to run that 3-person line. So if you cut one line off of there, you're going to reduce it to 2 and have about 5 people per line to run handhelds. I think that falls kind of in line with what I've heard that GRC is kind of considering, and other schools are considering, for how many staff members it's going to take to do that. Our simulation for the right with the automated system is, what we have on there right now is to show you that we're going to make the same recommendation to start. We do strongly believe that it is going to take less people to run the automated system, and we really hope through the demonstration we provided that every one of you all walked through today, that you were able to see that also. But with that being said, some of the key points to point out between the two systems is, it's the safety of the students, the safety of the staff, length of time it's going to take to bring the students through. What I believe most of you saw was something happened here inside the room. We kind of came to a clog. I don't know what that was. I wasn't able to actually see in the room. So I don't know if that was just people getting to their chairs, or if people were stopping to actually take their temperature on the tablet as well. But we had something like that happen. But it's also having people just group up on the outside of the building. Those are some concerns we have. And then the accuracy of what you're getting with that. If you want to go to the next one, Brian. So what we did was we took this handheld unit, and what we proposed last week was a 6-second read time with a handheld unit. And what we did was we brought 9 people into our office. We're about a 50-person staff, roughly, something like that, in our Lexington office. And we don't have everybody working in our office right now. So we were able to pull 9 people together, and we did a very controlled, simulated thing inside of our training room, and we ran every person through, and I took a scan of every single person that came through, and we were able to get through those 9 people in 49 seconds, which breaks down to 5.4 seconds per person in a controlled environment. So if you just calculate that out, roughly 1,500 reads is going to take you about 135 minutes, or 2 hours and 15 minutes to do that. 45 minutes if we're running 3 lines, which one of the changes that we made to make everyone aware is taking GRC's main entry from 3 lines to 2 lines. I still think we can get everything through extremely efficiently at 2 lines. But Brian, if you wouldn't care to go to the next slide. Oh, I'm sorry. One thing I did want to point out on the handheld was, I did not check everybody with a handheld as they came through, but one thing that is to be known about all of these systems is consistency with accuracy. So what a lot of you saw was no one had a fever coming through today. That's great. So everybody was under, we had a set threshold of 100 degrees. So if anyone would have been 100 degrees, they would have set that system off today. What a lot of you all didn't see, that I know Donald did get to see, was we actually took that threshold down to 96, and multiple of us walked through, and we all saw the red alerts come up. Very quick, easy read on the screen, just red signs and red boxes around people's faces, so you quickly know they have a fever, I need to do something differently. With that being said, I'm going to just real quickly show everyone, I've got a nothing read right now. I'm 97.7, I'm 97.5, I'm 97.7, and I'm low, and now I'm 97.2. They all vary. No matter what system that you have, accuracy is going to vary. This has a 0.9 degree. Our system that we showed you on the outside today has a 0.54 degree Fahrenheit difference. The other big thing is this has a 1.2 to 2 inch read range. This means you will be putting staff directly inside of a social distancing barrier with your students. Every single read, you will be doing that. They have to get within 1.2 to 2 inches to get a read with this type of hand scan. So I'm not telling you this is the best hand scan that you can get out there. You can spend more money and get ones with longer read ranges, but with the one we use, that is the read range on it. There's also the responsibility and the liability that falls on your staff when you all are doing that, because you all are going to be the ones doing that read and then telling the person they have to move on, and then accuracy and speed. So you've moved on to the next slide, which is, this is the automated system. So at our office, we have a different type of system. It's the same system as what you have, it's just the mid-range system, because we don't have as many people that are going to be coming through our unit, so we did not need that size of unit that we had here tonight. So with ours, we were able to do it in half the time. We took those same 9 people, we took them upstairs, and we ran through the walkthrough scanner, and it took us 2.7 seconds per person, roughly 1,500 reads, 67.5 minutes, 1 hour, 8 minutes, 22 minutes with 3 lines. So just based on our controlled testing that we did it in half the time. The big things to point out again are, with this, with what we showed you tonight, we're able to do a 5 foot wide line, 10 feet long, and hopefully what everyone saw was smooth moving traffic going right through this thing. Nobody had to stop. You were able to quickly go through the line. So we provided you good spacing, creating a safer environment, bringing the people in. We did not have a backing up problem. The only backing up clogging problem we had was something that happened inside the room, which I'm still not aware of what that was. And the amount of extended time for the additional staff to be running this type of system in comparison to the other. So one thing that we realized, and me and Brian had looked at this also last week, was, last week we talked a lot about what the actual cost versus, any kind of savings that you all have. And even in discussing with Brian, when the school needs to look at how many staff it's going to take to run this system, okay, they have X amount of staff that has to be there anyways, every day. If there's no COVID, you have so many staff there getting kids off buses, directing them. So we're trying to come up with a number that says additional staff that it's going to take. Well, then the other thing is that additional staff, they're still staff that you're paying. We understand that. But the one thing that is very true is that you are pulling staff members out of their classrooms. You can't put students back into the same environments like you used to in cafeterias and gymnasiums because of all the spacing issues. So the big question becomes, what do you do with these students for 45 minutes while the teachers have to sit and finish scanning everybody else, or 30 minutes, compared to 5 to 10 minutes, if even that long, to get them through with an automated system? So we have 10 total buildings included as of right now. What we did was we reduced kitchen entries, and we reduced the one additional line at GRC in the front. We removed the ATC entry, so we have a lower level and 2 main lines on the front, and then we added, and everything else is the same. We also added intercom units into the reception areas so that you also had parents. So some locations already had that, but anywhere that didn't, so for instance, the preschool has an intercom already in the vestibule. However, GRC does not. So now you'll be able to go in, and when you're a parent, you buzz in from the outside, but once you come to the vestibule, you would be able to buzz in again. They could tell you, let me see your temperature. Mr. Heisel, I know you were having an issue when you were coming in today. The tablet was not reading you, and then we said, will you move your mask? And once you moved your mask, it did read. So and I spoke to, our gentleman we had with us is the lead technical support person for the company. It reads your tear ducts. So for someone like you, for example, is you have a high mask and you also had glasses on and it can't read through your glasses. So it's looking for, the way he explained it to me, it's looking for the hottest point on you, but it was not able to recognize that. So once you were able to remove your mask, it picked it up. So at the reception entries, the benefit is that's a controlled environment, and the person talking to the parent or whoever on the outside can say, remove your mask. And then once they do that, okay, you're good, come on in. With that being said, we do feel that there still is a return to the school, whether because, and Brian, I don't know, did you have something?
Right, so some of the talks that we've had with other schools that are looking at, school systems that are looking at this, is that we really can't do a dollar return on investment based on labor savings because these are salaried employees and the expense is going to be there. And we've even talked to businesses that feel the same way. So what they really did is they're just using this as a guideline. If they could consider it, what kind of time we're talking about and the value of that time, because that's time obviously they could be spending with the kids in the school, in the classroom, teaching and doing everything else but having to deal with this product. So we're focused on safety and then of course eliminating this responsibility from a teacher and putting it into the analytics so that the teachers don't have to be saddled with that responsibility. So this is just information used to consider. We realize it's not a cash situation.
It's not like a business would typically consider a return, and we understand that. But it's also one thing that the main kind of points we wanted to point out was we do feel this is a safer approach, this is a faster approach than doing handheld units. We also do believe it will use less of your staff. I'm not comfortable telling you how many less because I don't think, much like this whole disease virus is, we don't know. Until you start using it and you're able to get your hands on it, what I can tell you is I'm not a trained person, but I was able to watch every one of you all from both rooms run through that system very quickly, never saw a temperature, and everyone went in. And that's what the expectation should be put back on you all, is that all you have to do is look at a screen and you know whether or not you're telling them go here or they just keep moving. And that's all that we have to offer tonight, unless there's questions.
So in the last presentation, and thanks for coming back, appreciate that. In the last presentation, it's mentioned that there is reports available that can be, I guess, exported and published maybe? Is that correct?
Yes. So great question, and I believe one of the questions was even, can it be automated into like your boards?
Right.
So the answer to that is no. Unfortunately, it can't be automated, but they can be pulled and then they can be put into a format for you all to post to a board. So the answer is yes.
Okay. So school could say, you know, we scanned 1,400 students today, or whatever the number is. We had two students that, you know, that was high temperature that we addressed or something like that.
Yep.
And that could be pulled on a daily basis.
That can be pulled on a daily basis, yes. And it reads low, normal, high, and there was one more. He actually pulled the report while he was here tonight. He pulled it up on the screen so I could see it. But there was another one and I didn't see what it was. But it was low, normal, high, and then something else.
And the other aspect of this technology that I'm really interested in, because I think COVID, let's hope, you know, we're looking at months and not years of this, okay, is the facial recognition part. So if we did move forward with this and the purpose of it was to take temperature, you know, initially, but then what would be required to, let's say, a year and a half from now, we don't need really the temperature reading, we want to do more of the facial recognition, make sure it's a safer place, school's a safer place, and, you know, people are not in the building, they don't supposed to be in the building. What kind of change is required for that?
If anything, firmware updates, depending on whatever new is out there. But beyond that, it's just programming of the unit. It's importing the faces into the unit or capturing, no different than how you learn someone. So the way you learn people's faces into that unit is a couple different ways. It has to be a high definition image, a 1080p image of the person. So an iPhone picture of someone or something sent in. Or the best way to do it is to actually capture their image inside of the sensor itself. So the sensor has two cameras in it and it has one thermal. If you saw you had two, I don't remember if we actually had two, we had two images. Did we have two images pulled up? Yeah, we should have. So you should have had a thermal. I don't know if we did or not. I'm feeling
What
like.
we had is we had the analytic and then we had the faces being captured. So you were actually watching the face capture on the right-hand side if you noticed.
Yeah.
With the temperature.
So
It wasn't thermal.
But it does have two images, and you can actually pull that camera up and see, like, if anyone has seen what like a thermal image looks like in either the color display or black and white, you can do it like that, and then it has the 2 megapixel high definition image on the other side. So the best way is to actually capture their image in the camera. But obviously, if it's I don't know, any kind of bad issue, you may not want that person in to capture a picture. So if you could get that picture provided to you, you can import it into the unit.
And you can do both at the same time, correct?
Except for these are the problems.
Yeah, but
Yeah.
like a year and a half from now, we're not wearing masks.
Yeah.
You can still scan for kids that have high temperatures and
Sure, yeah.
address it. And maybe that time we're just talking about maybe flu instead of COVID.
Yeah, hopefully. We all hope.
Which I shouldn't minimize flu.
Colds.
Yeah, colds.
Yeah.
So the total that you have, the 573,000, is that taking out the additional devices at the high school?
So yes, that's taking out, so that leaves us with the 3 lanes at GRC, being 2 at the top, 1 at the bottom. You still have the tablet that you saw, you would still have that at the reception entry, and you would have an intercom there. Campbell, you would have 1 main lane at the front. You would still end up with 1 tablet in the at the reception area for them. We did remove the one in the back because that was going to be staff entry mainly, and we felt that staff can do something like a portable unit. Baker Intermediate would have 2 main lanes, and that's because of the way that they come in on both sides of the building. And then you also had a tablet at the reception area there. Strode Station was 2 main lanes and a tablet. Concrete, 2 main lanes, tablet. Justice was 2 big lanes like what you saw here, and a tablet. And just so you know, like most of these elementaries, what you're looking at is 1 in the cafeteria for bus drop-off, or a back entrance, and then 1 at the main entrance would be your 2 main lanes, and then always the tablet at the reception area. Shear was 2 main lanes and a tablet. Phoenix was 2 tablets, 1 at the front, 1 at the back. They don't have the mass influx coming in. Preschool was 2 main lanes and a tablet. And central office was 1 tablet just for the main front entry. We're not as worried. Staff again can do this, but it actually is more for the look of the public coming in, and then also into band list type things in the future if you do that. And we removed the maintenance building and the bus garage all together, and we removed those kitchen entries. But does that answer? Okay.
So you removed everything from the ATC?
Yes, out of the back.
So everyone will need to come in front. What's the reasoning behind that?
Cost savings.
Well, I mean,
No students come in that back door back there.
Okay.
They come into the student entrance or the front entrance for ATC
Okay.
or anybody.
I just want to make sure that was the case.
It's not really a change, that's what it is right now. The only difference will be your staffing.
Do we have handheld thermometers already?
Yes, yes, we do.
Enough to start school?
Well, when we talked about it, yes, we think we do, yes. We've already put them out for all your athletics, we put them out for parts that are already up and operational. We got enough already at the transportation department for them, so yeah, we got enough.
And remind us, with the unit that's been proposed, how many students can we scan in a second?
it's 30 people per second is what they have on their sheet. And I do believe that we never had 30. We had roughly 6 people all standing inside of one image tonight and got a temperature on every single person. I think fair math, just so everyone knows, I took, based on some of the concerns from last week, I redid a spreadsheet and kind of came up with, if we used a 3-second number for a read time going off our 2.7 controlled environment, I still did come up with at 3,700. I just did 3,700 students, not knowing. And I came up with that's going to take roughly 3 hours across the 10 buildings versus 6.17 hours using handhelds with a 6-second read time. I do also feel it's very much the case that when I say we had a controlled environment, I had in an office setting with our accounting department, our sales department, and we had a very controlled setting. I don't feel that's going to be the case for you with a student environment, that it's going to be nearly as controlled or as quick.
How many bus drivers do you have?
That's easy.
And they all come in at the same time?
No, they come in, they have 4 o'clock in, and the bus drive, so they would, one of these.
Oh, there is going to be, I thought they said what?
We don't have one at the
Yeah.
No, we can.
No, they do not all come in at the same time, no. They're scattered out. Some routes start at 6 a.m. and some don't start until 7:30. So they're scattered out in that time.
I mean, I'm just thinking if we're going to put them and have them out, you know, you're going to need them to be able to get checked in, out, and get on the road without them getting gridlocked at the bus garage trying to, I mean, Donald, you know more about that than what I would know, but.
There's a lot in there within a 30-minute period of time.
Yeah, I mean, I don't know.
Well, at my place of work, I mean, we're hustling them in, and we're using a handheld system like that. I'd be curious to know from Mr. Christie's standpoint, if you and your staff have put a pencil to, what do you think the real dollar savings might be? And then secondly, what alternatives have you all looked at, or do you need more time? If the board is reluctant to invest $573,000, do you potentially need more time to look at other alternatives?
Have not put a pencil to it, because I'm the one that made the statement. It's hard to say because you're saving this amount of money because your teachers are only having to work this long. Teachers are under salary. We pay them the same whether they're checking their temperatures this way or whether they're, so it's not, for me, I don't look at it as a cost savings per se that way. It's more the safety of it, it's more the accuracy of it, more the possibilities of using it for other things at other times other than COVID. When this does go away and the masks go away, we're able to get those, get facial recognition. I can see it being huge at our Phoenix academies for students with court orders, parents with court orders, domestic violence, sexual predators that's convicted of that. You get photos from court systems, those can be loaded in to tell you when they're on. So I think it's got a wide variety of, it's huge on the safety side. I have not looked at others because I think this gentleman said last week that, or when our original conversation, and the originality of all this, it was about 3 manufacturers, and now in the last 3 months, there's become 33 or 43 manufacturers because there's a need. They're popping up everywhere. So I get emails that's got others. Some of them look overly simple. I mean, they look so easy, just a tripod and a camera, and that's it. So I don't know yet how those are timed to their computer systems, how they send the alerts. I can see it at a point in time. This gets to where when you're beyond this goes to a certain depth, and there's somebody that monitors this stuff on a daily basis. We're looking at the extremes right now, checking every single one, every single day, and every person that comes in. Right now, I think when you get to a point where you're just scanning for temperatures, things like that for flu season, those kind of things, when some of this pressure comes off of this, I think the number of people that it takes to monitor it will drop. And, this is something this is one of the biggest concerns, and I think these guys back here can support me on this. When we talk with principals, one of the biggest concerns of principals and teachers is standing there in front of a student, taking temperatures from 2-3 feet away. That's the biggest concern for everybody's involved in that.
Now, what we do is, sometimes we'll have people in personal protective equipment, and then we'll have a mask, and then we also do use a face shield and then gloves to protect them. So I'm not an expert on this, but I think we can reasonably protect our people using a handheld unit. Mr. Top, you raised a good point about facial recognition. I think that's something that will be useful down the road. I saw some demonstrations at an NSBA last year that as part of the ID systems, that would be another route. Let's say we didn't want to swallow this at this point in time. That's something we could revisit, that concept of facial recognition, tying it into our the generation of IDs for people. You know, if you've got slower people coming in during the daytime, you know, parents come to pick up kids or something like that, you know, you don't have to get 50 people in at one time. You can take a 1 minute, take a shot of somebody, run it through a database. So I think that's an important concept, but on during the daytime, there's other methods we have that we can address that. The facial recognition part. Because, I mean, there's a scenario where if things keep going the wrong direction, we can install this and then not have in-person school between now until when they come up with a vaccine or something, and then we say, gosh, I wish we hadn't done this. I wish we had a crystal ball. We could have just spent $25,000 on individual systems to go to school.
Well, at some point we will, at some point we'll go back to school. And COVID will probably still be around, I would say, at a much lower rate. And we will still be required to take temperature.
I was up in northern Kentucky. I saw something again on Brad Hughes, I think it is. You know, he's got a great Twitter feed of where they have a different type of unit, just a smaller handheld unit going on a tripod that does the same sort of temperature scanning. You know, this system's great. It's Cadillac. It's a Porsche system. Buck Rogers. But there might be some other alternatives that would be much cheaper that could still give us sort of a hybrid, could still do the thermal imaging and would be reasonably quick. And, you know, there's a middle ground on this besides this top of the line system.
If I could address the board, just two quick points. What caused the back up in the beginning, I don't know if everybody noticed, there were two options we brought today. One could be done for about $3,800. It's called a tablet or a kiosk. And what it is, it's a fancy handheld. So the one that could go on the tripod and the handheld still requires the approach, the reset, the move on, approach, set, reset, move on, proper positioning, all the same challenges. So the kiosk is superior in that it teaches the person that walks up, hey, this is what's going on. But you saw in real time, and I found it interesting, we were standing in different spots, Bobby, and we didn't get a chance to talk. But what caused the stop was everybody trying to come in through the kiosk. And so the kiosk represents the same concern of how long is this going to take. So in the slide that we had up, even if we use our mid-range unit, it's going to take 22 minutes to bring in 1,500 kids into GRC. So if you think about that versus the 45 minutes on the handheld, it's a significant difference, and the kiosks are going to have the same issues. The tripod's hand-mounted. So we just submit that if the time is important and the safety and the exposure is important, then there's the value. So I just want to make those 2 points.
So the kiosk is around $3,800, you said?
Got a law office right now that's using that to go in, and yeah, $3,800. That just was the quote we were just working on.
So would that be something that for the bus garage would be appropriate? Do they clock in? I mean, they clock in, right? They have a time clock down there?
Those devices are meant for not bringing in this amount of people.
Right.
I think we would all be shocked at how long it takes to scan in these numbers of people, even if we have 3 and 4 lines of folks. And that's the issue.
It basically does boil down to high flow, high accuracy. That requires the larger unit. Lower flow, a little bit lower accuracy. That is more along the lines of what you just showed on the tripod and the tablet that we brought tonight, and the handheld. I would put them all 3 in the same, because I believe, not knowing exactly what it was you showed, but I would say that was similar to what we had as far as the tablet. but it does have about a 1 second read time. And I think anyone that did stop at it could look back at their time walking through that, and I believe that you would all see that you did have to stop and then go on. What you saw with the other one is you never stopped. You just moved. And that is the goal.
So Bobby, I love the Cadillac analogy you're putting.
Yeah.
It's not a Cadillac, it's a minivan when you've got a family of 6 and not a two-seater. It's the right tool for the job if the value is there in the time.
You said tablet. The tablet and the kiosk is the same thing.
Yes, it is. I'm sorry.
That's okay. I just want to make
Yeah,
sure.
it is.
I'm getting confused.
Well, my stand is that we've sat up here so many times, we've talked about, we've argued over grass, we've argued over whether buildings match, we've argued over this, we've spent extra money to make sure buildings match, we've done this, we've done that. Now we're talking about something that could benefit these kids or keep kids safe. And you're talking about something that we can use for other things, such as the safety part of it, which I love. I told you that when you came in. I understand that some of you, and Gordy is on a different way, he's had to deal with the safety part of it, being a principal, but as a parent part of it, I have had to deal with the safety part of it on other issues. I'm not gonna get into that, but when you get that phone call, you would love something like that, to know that there's something like this put in place. And I would much rather spend the amount of money on this, to know that that's in place, to know that my kid's in that building, and that something like that can catch it quicker. I'm all for it. I think y'all did a great job. I appreciate you all coming back, and it would have my vote today.
What are we gonna take the $500,000 from? I mean, we don't even have financial statements in our packet. We don't even know where the hell we are right now.
$500,000 from Alicia's committee.
The only place right now short of general fund is the COVID. There's about $950,000 left in that. There is, to be straight up, there's not a good chance of getting FEMA reimbursement. They didn't rule it out, but they didn't say that's a given. It's going to take a lot of heavy documentation to do that. We're prepared to try that. I'm also prepared to go through some other organizations to talk about. There are some organizations here that's all trying to help us with safety and other issues. Want to put money forward on some stuff. I would certainly entertain going back before them to talk to them about some form of contribution to this to lessen that COVID money.
144 in state schools.
I have 144,000 given to us in state schools that can only be used towards something like this. That's not our state schools that we run, our SRO program and our regulars. This is money for COVID-related issues that has to be entrances, camera systems. So
And that hasn't been earmarked for.
That could go toward this.
That hasn't been earmarked for anything else yet?
No.
Okay.
We just found out what the
We
amount
got
was.
the
Okay.
amount last week.
So is this what you would want to spend that money on? Is that your recommendation? Is this what you want?
I think I kind of tend to agree with what Ashley said. You know, we've talked about, we've done everything we wanted to be the leaders. This is a chance to be the lead. This is a chance to do something more for our staff and our students, help protect them and, or to make things safer year round. I think there's lots of other uses for it. So yes, I would, this is something that I have not. If you direct me tonight to, before you pull the trigger here, to look at, research some of these others, I'll do that. I have not. I've seen that very email, I think, that Mr. Heisler shared. I got the same one. I have not had a chance to talk to those folks. I don't know how the system works. The thing that got me was when he said, early on, when we first started talking to these folks about the possibilities of doing this, there are 3 companies that have been doing this for years. This is what they do. And now, since the COVID thing, there's now 33 companies doing this. And my thing would be to try to probably avoid some of those 33 until they've got some things tested out. If they just come up with their process in the last 3 months, I don't think they're going to be up to the speed some that these guys are. I would have concerns. I'd have to do some, with a lot of folks, do some research on those.
With this amount of money, do we have to get approval from Frankfurt?
I don't know.
To use the 144, they want a BG completed.
I'm sorry, can you repeat that?
To use that 144, they want a BG completed.
So it'd be pending KDE approval?
Yeah.
Mr. Christie, would you consider maybe doing installation in one of our schools and do a trial run of it? And with the thought that the school that we go into would be the one where we could get the most benefit down the road from facial recognition.
I would say yes.
And we
I would
could put it
say
in one and say, dadgummit, this is really helpful. I can't wait to get it in the others in the next 5 weeks. I mean, I really, it's so much money, and our contingency has gone so far down. And obviously, I'm a very conservative person. I like to try stuff out first.
I would say yes to that. However, some of the very things that Mr. Perry was talking about, people coming back and talking to you, how do I say, I think the high school is the most important place to put something like this, and I'm not worried about the elementary teachers, the elementary kids. How do I pick a building to do a technology like this and not do it in the others? And when we're doing it, because we don't want teachers standing in front of somebody and being responsible for taking temperatures, how do I take that off the high school teachers and not take it off the rest of the district?
Ms. Ritchie, I think I probably misunderstood the safety aspect of where you're coming from, and I apologize. How is this, I can see that it's going to make things go faster. How is it safer for our children? I misunderstood that.
From the safety aspect of it?
Yes, how's it
they
safe?
that they can put the pictures in, and if you're not supposed to be in that building, it will recognize you, correct?
If you're in the custody
But we could do that down the road with another system, because we're talking about visitors, right?
That's talking about anybody. If anybody's not supposed to be in that school and they walk up in there,
But when people first come in, or during the daytime.
at any time.
Of course,
If
that
you're
won't
talking
work
about-
right now, but they would, because people have masks on, and won't be able to recognize faces with masks on. But after all this is done,
If you're talking about a parental dispute, and one set of a parent is not supposed to have any contact, and that parent walks in that building, it will flag it, correct?
As long as you come through one of the entries where the sensor is, yes.
And that is, and there's no principals here, but I'm sure that they will tell you that is crucial, because, well, Gordy was a principal. I mean, I don't know how often that happens in high school. Did you do elementary, Gordy?
No, just,
I mean, in elementary, it changes.
but I think if they're coming in as a visitor, the way they should, then we can have a different type of system that can capture that. It's not nearly as expensive.
I mean, that's what I'm saying.
One of the safety things that gets brought up again and again to me is the pooling and the backing up of kids in large numbers in the front of a building. There's a lot of security concerns that arise out of that, not just health, but what's going on with that, and how long it takes to bring them in, possibly through inclement weather. So I think those are some of the safety concerns. And then, of course, that of the staff. Obviously, I highly recommend the PPE gear. I think that's a great step. But I think there's anxiety, between the person scanning, the person being be scanned. This automates it and takes that away as a secondary benefit.
How hardwired would the system have, let's say we did a test installation at a school. We could even potentially lease the system and not have a full-blown hardwired installation. Is that a possibility? We could lease the system, and we just pull a number out of a hat and where we're gonna put it to, so we're not picking winners and losers, and see how well it worked. Is that a possibility? And it could be, it would work like, my goodness sakes alive. We've got to get this in all the schools, because this is
So
we don't want to tell anyone else in the state, because we want to get in line in front of everybody else, because this is so daggone good.
Yeah, so if I'm understanding the question is, basically, can you lease it over a period of time? And then, I guess, to just ask another question back to make sure I understand correct. So would it be that in 12 months, you own the system, it's yours, it just stays with you, or in 12 months, you want to lease that we basically take it back, we literally just loaned it for 12 months?
I would view it really as a rental, and I think we could probably figure this out in about 2 or 3 weeks as to whether we really thought this was beneficial. So let's say we rented a system, I mean, y'all got to come in and install it, adjust it, and there'd be X price to rent the system for a month, what we call it. And then after that, then we potentially could decide to move forward either with returning it to you, because there wasn't that much of a difference, and we decided to go down a different path where we just used the facial identification system tied in with IDs to take care of that aspect. Or we might say, golly gee, we really need to get these in all the schools.
Bobby,
Yeah.
We're a family business, so I like the idea. The issue we're facing is logistics, and each individual camera has such a high individual cost that it would keep us from doing a true rental program. You could do a lease, but it would be the type of lease where the system owns the equipment afterwards. I would certainly do anything I could for the school, but just because of the dollar amount of the cameras, the demand for them, and just the sheer logistics of getting them. As a matter of fact, if we don't make, and this is not a salesperson, this is a consultant statement, if we don't get a decision in the next week and a half, we will not be able to get all buildings done by September the 8th. It would be impossible to get them all done just simply because of what it takes to get these things set up, get the equipment in. The equipment that you saw in the hallway has a black body device. That's why it was so accurate. That's the piece really holding everything up. So back to the business question, we could do a lease, but you wouldn't have the advantage of avoiding the equipment cost. So I don't think it would be advantageous to the board.
Then another option is we could simply buy one system for $30,000 or $35,000.
You could do something like that. The other thing too, that is, they are a completely like non-returnable item. And that's where they're on such high demand. That is part of the issue with these units. They take a long time to get in. That's part of where Brian was going with the last piece of that. But it is another reason why the rental, any other system, we would rent to you guys and no problem. I mean, camera system, access system, but these, it's just not available to us right now. But it's a great thought.
What's the warranty on those?
Though, I believe it's a 3-year warranty, but I can 100% confirm that for you.
But for $30,000 or so, we could buy one system. Try it out.
Yeah, approximately. I mean, I'd have to take everything off. Every school's going to vary a little bit in labor, but approximately.
That's a gigantic round number.
Yes.
Question on the, I'm sorry. go
No.
ahead.
Would you need other quotes when we're spending this kind of money?
Yes, for procurement, yes. We have to have.
I will also say we are a state bid contractor, just to
You
make
are.
the board aware of that also with a state contract number.
So if they're on the state bid, do we still?
So if they're state bid, then no, I didn't realize you were state bid. So if you're on the state bid list, that covers it all.
Mhm.
Okay.
Question on the monthly service investment. Is that, I mean, that's every month?
2 years is included.
2 years is included?
2 years is
Okay.
included on everything that's calibrating your system, that's loaner investment. So basically what that loaner program is we keep stock of this in our office, and if anything ever happens to any piece of it, whether it's the network video recorder, the black body device, the thermal sensor, we have a device that we can come and put in so you don't have downtime. You may have a couple hours, maybe a day of downtime, but you're not going to have weeks of downtime while we send it off. We send yours off for repair. If it can't be repaired, you do get a new item that we put in at no additional cost to you. It covers labor, material, everything is covered under our warranty.
Okay. I'm listening, I'm calculating too.
On your all's list, which one of these items is the camera?
So I need to get to, let me get to the proposal piece. So as long as your numbers kind of match mine in quantities, you've got a bunch of ones, then a bunch of fours, then a bunch of sevens. Okay, I want to make sure that we're looking at this the same way. It is going to be the second number 7, the thermal hybrid network sensor.
Is thermal hybrid, is that a brand name?
No, it's not a brand name. We do very generic descriptions. We always have done that in our proposals. It's if we need to provide all the manufacturers and everything, we had them here tonight. He had it all over his shirt. We typically don't include those in our proposals, but we can, absolutely.
So we don't know the manufacturer, we don't know the model number of what we're buying.
Oh, we can provide that, no problem.
It's not in the proposal right now.
No, it's not. So for competitive bidding, I can tell you in just my 15 years of experience of doing this, competitive bidding, I typically never provide that because it's not really fair for me to teach my competitors how to make the soup.
But to the customer, obviously.
To the customer, you need it. I didn't mean that rude. Sorry.
You'll have cut sheets.
I'll get you whatever you need.
We'll go around this term of on the state bid list, but, I mean, so this particular camera, let's say, well, tell us exactly what the brand name and model is. we gonna find that on a line item on the state bid list is exactly what that camera is being sold for? I don't think so.
I mean, I would have to look and 100% tell you that.
But with them being on the state bid list, they can add anything on that state bid list. I know there's a process for that, but you can add items to the state bid list when things come available, correct?
Well, you can, there's a process, there's GSA, there's also the state bid. The GSA is the most rigid and most specific. So you have some clients that look to use labor guidance off of it for certain things or specific parts. And so we would obviously just need to have a conversation and ask what you need in order to satisfy this county's specific needs to make that either something that's beneficial or not. Obviously, I think any of our pricing or installation is going to stand up well to any type of competition, but we would just have to consult with whomever knows the requirements, and then we'll submit our documentation. I've got a thing this thick to submit. Here's what we have. And to the point, it's a very good point. This product is too new to have specific line items, but the labor categories may be beneficial, so we just have to work on that together.
So the being on the state bid list doesn't mean that it's on a bid list with a price tag on it. That's more of a generic description of the vendor relationship, or that they're an approved vendor. But the potential there could be some benefit to it being bid out, as we saw an hour ago with a little competition on the chiller, brought the price down substantially.
Mr. Heisey, you mentioned a little bit ago, and I think it's a wonderful system, there's no doubt about that. I just have a lot of issues with the cost. And you mentioned a while ago, well, what if we set this up and we just absolutely loved it? What is our criteria for why we love it?
I think the criteria would be that we could eliminate any bunching outside, and we could reduce the labor costs and get teachers back in the classroom and not take a temperature.
I just, I just look and see, and again, I think it's a wonderful system. I understand why businesses do it, and it's impressive to look at, and, and I definitely appreciate all the time that you put in doing it. Just looking some stuff up, and I know people can find what they want to do, but, one study in New York, Northwell Health, 5,700 patients in their hospitals, only 30% of them had a fever when they arrived that had COVID. Their physician-in-chief stated, "Does not give me a sense of security that it's going to be an effective way to know whether someone's COVID or not." World Health Organization on their website, such measures require substantial investment for what may bear little benefits. I just think we come in and I think it's really impressive, and I think it would show a lot of people that, yeah, we're trying to do many things that we can do. But if we have one outbreak, people's gonna look at you and say, you spent $500,000 and you can't keep my kids safe? Then every bit of what we've spent, every bit of the goodness we tried to do is just gone at that point. And I understand what we're trying to do, and if we could stop it or whatever, but I think of situations, you got a kid at the bus stop that's got a fever. He's with 5 other kids at the bus stop. He gets on the bus with 15 more kids. He gets off the bus and he's in a group of 30 kids when he goes in. And he goes in, he's got a fever, and we put him in the room. And then he's been with all these other kids right here, and it's went on to the classrooms right there at this time. I just, I don't know. To me, it just seems like to me that we're rolling the dice, and I think everybody's heart's in the right place. I understand, and I look over at Bourbon County, it's not having school because they can't afford to clean their classrooms, basically. We're talking about $500-some thousand, and we're debating whether or not we can spend another $130,000 on school supplies. I don't know. It doesn't add up for me, and I think there's things that it might be able to do for us at other times, but to me, it just doesn't seem like what we have right now supports something that's going to be foolproof now. I just feel like I'm spending $500,000. I want something foolproof. That's just my opinion on that.
So, Mr. Peridot, can I
Sure.
say something? So with that being said, definitely appreciate everything that you just said, and I 100% agree with you. The decision, sharing to tell you, like, listening to what you all have done in this room the last 2 times I've been able to come to this meeting literally blows my mind. I've told Brian, I have a whole new respect for the decisions that you all have to make. So if you don't make a decision, if you make a decision not to go with us, our feelings are not hurt. We would give this time to Clark County Schools. You all have we've been a partner of yours longer. I've been with us for 15 years, longer than I've been with us. You all have been one of our clients. So I promise you, it doesn't matter to us if you all purchase this system. As I told you at the very beginning, all that we are is we are just a piece of something that we know you're going to have to do. What I can tell you is we can only focus on what we can control. I cannot tell you, it's not, I've never once said it, it's not COVID proof. Nothing is COVID proof. This device does not tell you if you have COVID. What it tells you is, do you have a fever? What is a requirement that your schools have to go through? You have to check a fever. All I can do for you is tell you that I can get your students through quickly and show you whether they have a fever or not. But your concerns are valid and real, and they make 100% of sense to me. So I appreciate you sharing that, but I do just want to make sure everyone, we are not presenting our product as it is telling anyone that we're stopping COVID, but we are telling you we can quickly detect fevers faster than most solutions out there, and we can do that with using less staff and getting your students in the building.
Yeah, I agree, and I appreciate, like I said, everything, and I think it's a great system and all that, but I just think that sometimes we have to think, if we invest $500,000 and we have an outbreak, what did that $500,000 give us? That's just the part that I'm looking at it from. Now, if we were to invest it and nothing was to ever happen, then maybe we could say, this is what helped us. But there are just so many unknown factors out here right now, and we know we have other expenses that we're going to have that's going to come down the line for this. And do I have a solution for getting the people through there on time? Do I have a solution for people that are nervous about taking temperature? I don't have any of those things. I don't have any of those things. And some of the things that you do definitely helps out with a lot of those fears that maybe teachers and other people have. But and it may even, have some parents, well, I feel good about it because they've got this system in place, and make them feel good about sending the kids to school. But I just feel like that if we do have a situation where we have an outbreak, and I think all of our good just vanished at that point right there. And that's just my thoughts on it. Nothing against your system, obviously. I can sit there and watch myself go back and forth. I think it's amazing how things, work at. But I just think it's I hate to call it a risky investment, but I almost feel like it is a risky investment. But that's, and I certainly understand other people's feelings about how they want to do it as well.
I don't look at it, I don't look like investing in the safety of our kids, and the students, in case something bad happens. We should feel bad about that investment.
I don't catch what you're saying there.
I'm saying if we agree on this solution and then there is an outbreak, I don't think that we should feel bad that we invested that and there was an outbreak. I think we are doing this to help prevent and help isolate temperature control. Basically, that's what we're doing. Isolating temperature control as quickly as possible. We're getting the kids into classrooms as quickly as possible. And with that being said, they're not being around other kids. They're not being around other teachers as long. I just think that's a safety issue as well right now. And I believe, there is some unknowns. We may not even go back to school for a while, right? And the investment may not even be utilized. But I do think when we do go back, we'll probably still be required to take temperatures for the kids for some period of time. I hope that's not the case, but I feel like that we would probably still be required to do that.
Your comment about supplies is well taken too, that I can very well see getting comments from families that are not as well off as others, and they say, well, can you believe what that school district did? They spent $573,000 on gizmos, and I've got to now buy my own daggone supplies for the kids. That's how much they care about me as a parent. They could have easily taken it with handheld thermometers like everybody else is doing, but they wanted to do this, and now we've got to buy supplies. I know we'll get that call too.
Well, we also have funds that's specifically for COVID. So what are the other projects for $500,000, because there'd be about $500,000 left in the COVID fund? What are those other projects?
I think that's a good question for the superintendent. My gut feeling is there's going to be so many other things out there that we're going to want to tap into those funds that'll make our heads spin. Over, what's it, 2 years we have to use it?
Yes, 2 years.
But what's your opinion, sir?
Well, yeah, there'll be other things, just like we asked tonight. You know, there's areas, cleaning, there's areas, all these other areas that there could be, we may find, there may be areas in social, emotional instruction we need to work with kids. There's going to be other things.
Mr. Talbot, I hope I'm not coming across the wrong way. It's getting kind of late. It's kind of hard to communicate.
No, I just believe the safety and, I believe the safety outweighs the cost. I mean, we debated on grass not too long ago, like Ms. Ritchie mentioned. This is something that I feel is important for our students and the district.
And I think we can provide the safety a lot cheaper.
At a high risk for the future.
I think the safety situation, I mean, the virus itself, I mean, we can say, you know, you're spending $500,000 on trying to keep kids safe from COVID, but so many people are asymptomatic that, you know, you're spending $500,000 and you got a target you can't even see. And I mean, you know, we have situations we have to weigh all the time. You know, every time there's a school shooting, every time there's something, I mean, we could hire 50,000, you know, security guards to come in there and do that. And we could say we're doing it. This situation right here, in that situation, we could probably keep kids safe. Right now, we're spending $500,000 trying to hit a target we can't even see. That's the only part that bothers me about the whole thing right there. I'm all for keeping people safe. You know, my entire career was spent that way, trying to keep people safe. But I just really believe that the cost right now outweighs how safe we can keep kids.
Just make a motion and see where the cards fall. At this point. I mean,
That's fine, and you know, and again, I'm, you know.
We could go back and forth all night, I mean.
Well, that's what I'm saying, is that I don't begrudge anybody by the way they feel, the way they think, or whatever like that, because we could do this, be the best thing that ever happened.
Right.
But then weigh it the other way. I guess I'm weighing it more the other way.
So our time frame to get this in is that you need to know right away.
So it really depends on how many schools, you know, if you go to one of these options where we say we do one school, then obviously the time frame gets extended a little bit. 3 to 4 weeks is lead time on equipment. So what we were looking at is 10 buildings to get this system fully implemented. You have roughly 400 labor hours. I only have so many techs to put that kind of stuff in. We get into a real 8 to 10 week turnaround time to get everything deployed before a start date that you guys had originally proposed. So some things can change that, but yeah, it does need to be a fairly quick decision if you do intend to do 10 buildings before the proposed start of school.
I'd like to make a motion that we approve the purchase of thermal temperature imaging equipment for $573,249 with addition of the kiosk for the bus garage.
Now, can I ask, Mr. Christie, is this what you want? Do you recommend this to come out of that money that
I
you
would recommend
have?
it to come out of that money.
And this is what you want to spend the money on?
Partial. Maybe if you want to split it some way, but I'm going to, if you go to this here tonight, I'm going after a couple of places for some donations for this project. But
If you use CARES money, it's not reimbursable by FEMA.
Yeah.
You will not get reimbursed by FEMA if you use your CARES money.
But you got 144,000 from where?
Safe schools.
Safe schools. and then you take that out, so it leaves around 429 for CARES. That could come out of CARES. So you have about 500,000 left of CARES.
And of course, that means that's $144,000 you can't spend on other parts of, say, schools, because there's,
Cameras.
you know,
Cameras or vestibules is all this is.
So-
Front entrances.
Front entrance.
So you're kind of spending that on cameras with this solution.
And this counts.
Well, you're replacing the cameras with this.
With cameras already, we have security vestibules on every single building.
Yeah.
So that's not an option for us to use.
So what was the 144,000 kind of planned for? I mean, was that, you didn't have no plans for that?
And this does qualify for that purchase. Okay.
and I suppose that another scenario is you could, maybe for 144,000, you could, instead of putting in these automated, you could put in tablet systems that are going line. I'm just throwing it out.
Yeah.
But I guess that right now there is
There's
a
a
motion
motion
on the floor.
Does anything need to be added to that motion or approved, pending KDE approval? Is that right?
$500, I didn't get it.
I need to, yeah, specifically say it's for the code if we're gonna try to get anything else.
Okay.
That's right.
So I'd like to add, this is as a result of the COVID outbreak.
Okay.
Is that satisfy? Okay.
All right, you got that one? Okay, motion by Mr. Talby, I will second that. All those in favor say aye.
Aye.
Opposed?
No.
Did you vote aye or no?
I voted aye.
Okay, so motion carries 3-2. With Mr. Peridot and Mr. Hoddesdale voting no. Ms. Ritchie, Ms. Richardson, and Mr. Talby voting yes.
Thank you all for your time.
Thank you
Thank
for
you.
the presentation.
Thank you for coming back. All right, now somebody wanted to break.
I'd say we got a guy waiting here, right? How long will it take us to do this resolution?
Yeah, we can do that.
He's been here a long time.
Yeah, I know. Yeah, we'll do that, and then we'll do that, okay.
I can give you all, I mean, all we did the,
Item number 11. Consider the adoption of a resolution authorizing the Clark County School District Finance Corporation school building refunding revenue bonds for school building purposes.
Make sure Brian has his part in there.
And you would just need to, probably the motion would also include that agreement be between RSA Advisors LLC.
What, I need to read that, is that what you're
No,
saying?
you just need to make sure the motion, that if we have a motion on the table, that it include that the corporate issuance of the school building refunding revenue bonds would be with RSA Advisors.
Okay. Okay. Any discussion, motion? This guy wants to go home?
Don't we all?
Do you have a clear understanding of what the motion is?
Yeah. Do you need
The
me to
motion
read
is
it?
needed.
Do you need me to read it?
I would like to hear what the proposed motion is, so if it's clear, then somebody can say, that sounds perfect, we'd like to make that motion.
Oh, Jesus. Do you have it?
No, I don't. That's why I asked you for it.
Okay.
Or maybe Mr. Thomas could describe it for us. He's a pretty smart fellow.
It would be to adopt a resolution authorizing the Clark County School District Finance Corporation to issue school building refunding revenue bonds for school building purposes with RSA Advisors LLC.
Does that suit your fancy?
Let me pull up, wasn't there some specific
I guess we need to
additional wording that they had on there?
Well, we just need to include in the approximate amount of $2,290,000.
Because
I read that verbatim from the motion, from the agenda.
So from item 3 of the finance agenda, where it has the resolution that's about, I don't know, 12 lines long, is that resolution plus that additional wording you just said?
Well, the wording that I said was basically paragraph 3 of the amended notice meeting of the District Finance Corporation, which was moved almost verbatim to the agenda, item number 11.
There is in our packet a Clark County School Board resolution that's about a dozen lines long.
Oh, yes, sir.
So I was wondering, that resolution plus the additional wording you just said, kind of seems like that would be the totality of the resolution.
That would be correct.
Okay. Mrs. Nance, are you clear on what Mr. Thomas just said? So I would like to make a motion that we move forward with the refinancing of these bonds per the exact wording that's in the Finance Corporation packet item number 3 under Clark County School Board Resolution, and also including the wording that Mr. Thomas just described as additional clarification.
Okay, we got all that. All right, motion by Mr. Hodgson. Is that you, Gordon? Second by Mr. Pearson. All those in favor, say aye.
Aye.
Opposed, motion carries 5-0.
Thank you, guys.
Sorry.
Now we're gonna take a.
Yeah, 5 minutes.
Spirit of your smart wearing long sleeve shirt today.
Get a bunch of cool or
I'll tell you what, I'm freezing over here.
What?
It
was hot.
Yeah, no, that's
Experience I got on.
Oh.
11. And we are on item number 12, superintendent's evaluation summary. At this point, I guess I'll just read this out loud. Put this on the minutes, is that how this works?
Sometimes they publish them on the website too.
Okay. Whatever they want to do, but I'll read it out loud. Are y'all ready? All right. The Board of Education of the Clark County Public School District has completed the annual evaluation of Superintendent Paul Christie for the 2019-2020 school year. The evaluation focused on 7 standards of performance for the district agreed on by the board and superintendent. Superintendent Paul Christie received ratings in the areas of strategic leadership, improvement required, instructional leadership, developing, cultural leadership, developing, human resource leadership, developing, managerial leadership, developing, collaborative leadership, improvement required, and influential leadership, developing. The board will be working with Superintendent Paul Christie to develop goals for our district for the 2020-2021 year. We look forward to working together to make our school district successful. And that will sum that up. If there's nothing else there, we said, we will move on to consent agenda. Did you want to say something? Okay.
Well, yeah, I mean, I'd like to make a statement about this, unless anybody else was wanting to do that first.
Go ahead.
So I'll prepare a statement I'd like to just read out loud. I'm gonna take this off for the time being. I'd like to make a brief statement regarding the superintendent evaluation of Mr. Christie. The Board of Education's purpose is to make sure every student receives the best education possible. We strive to accomplish this by providing the tools and programs necessary to develop higher learning in a safe and secure environment. We try to accomplish all of this by being fiscally responsible. We are living in unprecedented times. Hopefully future generations will not have to deal with the pandemic outbreak, but if they do, my hope is they can look back at what we did as a guide to help them through the situation. Since the outbreak and closure of the schools in the spring, I feel like as a district, we have not worked together for the betterment of our students. We have had our leaders step up during this time, and we've had our distractors. Mr. Christie is the leader of our district, and will require everyone working with him and his staff if we ever want to get back to some sort of normalcy. Too many people in this district has their own agendas. I ask everyone to come together as a team and do what's best for our students and staff. As a board, we can only evaluate the superintendent. This year, my evaluation of Mr. Christie is a reflection of the district over the past several months, more so than him. I realize that's not fair to Mr. Christie. I do believe he is doing everything in his power to develop plans on how to reopen our schools. I say plans because it can't be static plan, as we mentioned tonight. It's got to be a fluid plan. Things change on a daily basis, and it will be based on circumstances at certain times. I encourage everyone to communicate, work together, and let's do what's best for the students and staff of our district.
Thank you. Anyone else like to make a statement? Okay. Well, I would like to thank Mr. Christie. I think under your, you've done a really good job trying to lead us through this response with the coronavirus. We were on the forefront to get the NTI days approved and implementing process for educating our children during this unprecedented time. With the addition of Chromebooks for our students, we are equipping our kids with the tools to succeed and to ensure that we leave no child behind in the education process. I think you've done great with acquiring PPE and sanitizers for our schools. You've done great with the feeding program. Through all this, I'd like to thank you for doing that. To follow, I think Mr. Toby's statement was great. I'd like to see everybody work together, build this district back. And we're starting this off, and it's gonna be hard, and I think we all need to work together, leave everything else behind, and pull it together, and start making the best decisions for our kids, for this district. And if nobody else has anything to add, then we'll start with the consent agenda.
I have a comment about consent agenda items.
Okay, go ahead.
The financial statement and the contingency, the budget report and the balance sheet report are all missing from the packet, and I find that to be very upsetting. I know there's reasons for it, but it's a very critical tool for me to be able to evaluate where we are, especially because I had concerns last month about how we would come in on taxes. And I think if we had that, we will realize might be $700,000 or $800,000 short of where we thought we were, and it potentially would have changed some of our actions tonight. So I'm very disappointed it wasn't in there.
Anything else? Anybody want to pull, table?
I have a question on athletic fields. I'm sure it's late, and I'm sure who's on the line, but where are we on, like, softball fields, baseball fields? Are they progressing?
They're progressing. Baseball field is a little bit ahead of the softball. It's on grade, on laser graded. They're doing the drainage system, and it'll be ready for turf. While they're working on the drainage and the turf on this one, they're getting the softball field ready. The turf will start, I think it's tomorrow, or it'll start this week, going down in the indoor turf will be going down this week. They're already doing the curving around the parking lot, since the curbs are up, since those are poured, and the asphalt will be the next, so the parking lot will be asphalted. Talk like most everything within the next 30 days, with the exception of the finishing of the turf. But the indoor facility will be finished within the next 30 days, the parking lot will be finished, and then they'll be on to the landscaping and some of the siding and that stuff, what they can do short of leaving room to get the turf brought into the fields.
Mr. Christie, did you say the turf won't be done still for another month?
I've not gotten a date on the turf. They have it laser graded, and they're putting the drainage system in. As soon as the drainage system's covered back over with rock, then the turf starts to go down. I'll find out Thursday. We got a construction meeting Thursday out at the job site, and they're meeting in the field house. Practice field house is where they're meeting now, so if anybody wants to come to that. And there'll be some more dates put out there. But now I said they've been meeting in there, but they may have to go in one of those side rooms, because they're going to be laying turf, hopefully, but Thursday they'll be laying turf on the indoor end out there. And all the punch lists and everything in the gymnasium are just about, we're right at 100% complete on the gymnasium stadium side. Got a report, let me make sure that I didn't miss something else.
Okay. Are you good? Okay. So with that, would anybody like to make a motion for items number 14 through items number 25?
I'll make that motion.
Motion by Mr. Tolley.
I'll second.
Second by Ms. Richardson. All those in favor say aye.
Aye.
Opposed?
Aye.
Motion carries 4-1. With Ms. Ritchie, Ms. Richardson, Mr. Tolby, and Mr. Peridot voting in favor, and Mr. Heisel opposed. Item number 26, authorize a payment of salaries and accounts payable.
I'm for that. I'd like to make that motion.
All right, motion by Mr. Heisel.
Second.
Second by Mr. Peridot. All those in favor?
Aye.
Opposed? Motion carries 5-0. Motion to adjourn. I make that motion.
A second.
Second by Mr. Tolby. All those in favor?
Aye.
Opposed? Motion carries 5-0. Oh. at 10:21 PM. Scott, you